So first thing is, when we read biostats, what do you mean by inferential statistics? Inferential means you take the result from a small sample of people and then apply it on the whole population. That is inferential. So confidence interval and standard error, they are inferential. We always collect it for a sample and then apply it on the whole population. When it comes to descriptive statistics, we have mean, median, mode, which tell about central tendency, and then we have measure of dispersion. This measure of dispersion is told by 5 things: range, variance, mean deviation, standard deviation, and standard error. But standard error always we collect for a sample and then apply on population. So that is more of an example of inferential statistics. And when it comes to theoretical statistics, it is p-value, alpha, beta error, null hypothesis, all that come under it. So a very good question came on it also, that if you have quartile, percentile, or outlier, what do they tell about? So they always tell about position or location of data. Like for example, if your result is 99 percentile, it means your position is top and almost in the toppers, location is top. So percentile, quartile are position, and these are different type of biostats. Let us start with the first part, that is how to what is this null hypothesis, p-value, alpha, beta error. So whenever you do a study, there are 4 steps of doing it, and you must do some study if you want to earn billions of rupees in future. Because when you present your knowledge in the form of study, only then it can get the patent and give you the money and help millions of patients also. So the first step of any study is we generate null hypothesis. Null hypothesis simply says that the new study or the new drug which you have found is not significantly different than the previous drug or previous study. तो null hypothesis बस ये कहता है कि हमारी नई दवा null है, lull है, useless है. The new drug is not significantly different than previous. And suppose you have found a new drug to prevent to decrease obesity. So you can say that my new drug is same as the old drug which nowadays people are using, that is to lower the weight, and the Mozambique and some other new company has found a new drug which is actually anti-diabetic, but it is reducing the drug. And now you have found a better drug. So in the beginning, if you say that my drug is better, it means you are already starting with a bias. So in the beginning, you will say my drug is same as previous drug, not significant. So basically, scientists give null hypothesis, but usually all the researcher want to reject null hypothesis. Let me explain it with a very simple example. Suppose a boy proposed to a girl, and the girl said that I have not seen you from that angle. You are not significantly different from my previous friend or other friend. So what the girl gave to the boy? Null hypothesis. So now the boy will definitely try to reject the null hypothesis and show the other angle. So similarly, we give null hypothesis in the beginning and then we usually try to reject it. So after giving null hypothesis, we decide the mistakes. And whether it's your life or your exam or a study, there will be 2 types of mistake which you will be doing. One is alpha error, which is type 1 error, which simply means, if you write alpha error, it simply means false positive. You wrongly say that your medicine is good when actually your medicine is not significant. So alpha error simply means saying non-significant result as significant. One very good example is coronal drug study. When the coronal drug study was done, all the patient which was taken was asymptomatic without fever. And in the end of coronal study, the researcher said that coronal drug can treat corona fever. So if everyone was without fever, how can you say that it can treat corona fever? It means the researcher of coronal drug trial, they were trying to give a false positive report. They were trying to prove their non-significant coronal drug as significant. That is alpha error. It's a very simple thing actually. When you overestimate yourself, that is alpha error. For example, in the upcoming IMNCI exam, if you thought that I will attend 20% question and I will mark 5% wrong, 80% I will attend, 20% I will leave, and in that 80%, 5% I can wrongly mark. So those 5% which you are wrongly marking, that is alpha error, where you overestimate yourself, thought the result is positive, but you were wrong, false positive. And that 20% question which you left, in those 20% question, you underestimated yourself. That is the beta error. And beta error means saying significant result as non-significant. Actually, in those 20% question also, if you rule out the options one by one, then you can do much of the question. But in those 20%, you underestimated yourself, and therefore beta error means false negative. When you say that you are actually not significant, that is beta error. And it's very important to know alpha beta error, because we will later on learn that alpha error and p value, they have the same meaning. So both means false positive. To remember it forever, let's take that example of the boy who got the null hypothesis from the girl. After getting the null hypothesis, he's back in the hostel, and now he's doing a research on how to propose the girl properly. And whoever come from date, he's ready with his diary and asking how the date went. So first a senior went on date, and when the senior went on date, he thought, if I will tell my feeling to the girl, our long friendship can get affected. So he said nothing, just have coffee, and came back. And now a junior is asking from the senior, how was the date? So what the senior will say? अबे जानता नहीं है तेरा बाप हूं मैं ना, you don't know I'm a father. We did this in the date, that also, and that also in the date. So what the senior is saying? He's saying a non-significant date as significant. He's giving a false positive report and trying to be the alpha male. So this is when senior went on date, he overestimated his dating capability. Now suppose a batchmate went on date, and when he went on date, he gathered the courage and told the truth that I like your nature, and I like to spend time with you. I like your curvature also. I like your smile also. And the girl said, why you didn't said to me earlier? I was waiting for last 3 years. And the girl gave also a kiss on the cheek of the boy. So how was the date? The date was significant. But this batchmate, when came back in hostel, he know that if I say the truth, that I got a kiss and the date is significant, first this batchmate will ask for party, then all of the friend in the hostel will ask for party, and then wherever they will see the girl in the campus from the next day, they will shout कि भाभी जा रही है, भाभी है ना, brother-in-law, brother's wife is going, they will shout, and their love story will sink before floating. So what the batchmate will tell to the batchmate? That nothing happened, you know how shy I am now, nothing happened. So here the batchmate on date is forcefully giving a false negative report for his date. His date was actually significant, he got the kiss, but he is saying, underestimating his date and saying non-significant. So you can use this example to remember it and apply it in many questions which they are coming in INCT exam on p-value alpha beta error. So after deciding the error, then we do our study, which can be RCT, cohort, case control, and we have to know what are the steps of doing this study, because they're asking that. We will read that. After doing this study, the data which comes, we put the data in computer and give the command to computer, apply chi-square, pair t-test, unpair t-test, sign test, and in which condition give which command, that also we will understand, because they're asking a lot of question on that. After applying those chi-square and pair t-test and all from the computer give the result in terms of p-value, 95% confidence interval, mean relative risk, and mean odds ratio. And based on these 2-3 things, we decide whether our study was significant or not. And if the study is significant, we will reject the null hypothesis. So based on this 4 variables, we decide whether to accept or reject null hypothesis. That is the last step. So what is this p-value? That we have to understand in detail, because a lot of theoretical question come from here. Always remember, p-value means false positive. p-value का मतलब है चालू बनना. When you act over smartly and say your useless thing as useful, that is p-value. Theoretically, p-value means probability of getting significant result by chance or by mistake. So to understand it well, let's me give you one very simple example. On the very first day of our MBBS counseling on 1st of August 2006, there was a very good girl. I thought that she's looking at me only, and her name was Monica, and I thought she's looking at me. So I was happy the whole day, and I had some butterfly coming out and all. And in the evening, when I went to my room, I told to my room partner Rahul that, Rahul, you know, Monica was looking at me. Rahul said, no, bro, she was looking at me. I said, you are so confused. Let's confirm it from Neeraj. We both went to Neeraj, and Neeraj said, you both are wrong. She was looking at me. And actually, she was not looking at anyone on that day intentionally. It was just her look by chance or by mistake, which we were thinking as significant. So p-value basically means तुक्के से सही, correct by chance, significant by chance. What is the meaning of p-value? you think that the look was significant, but the look was just by chance. So significant by chance is p-value, and on that day we were doing a mistake, an error now. So p-value is an error, and therefore we have to keep the p-value minimum. If the p-value or mistake is less than or equal to 5%, that means less than or equal to 0.05, we say that the mistake is too less, so we can trust on the result and result becomes significant. But the null hypothesis had earlier said that result is not significant, and finally we are getting result significant. That means the null hypothesis was false and we have to reject the null hypothesis. So remember this in your exam also. When if you in the IMNCI exam, suppose you do less than or equal to 5% mistake. So if you do this less mistake in your IMNCI exam, of course you will get significant result and you will no longer remain a null person, a usual person. You will become significant. So now you can reject the null hypothesis. Okay. So this is the concept of p-value. But let me explain p-value with a very good example to make it further clear to you. Suppose there is then we will come to the question after understanding it better. Suppose in your batch there must be one boy or one girl who can tell about other couple that will they last long or will they just end up very quickly. So suppose this capability is in you, and you look at the first couple who was sitting in the park and you guessed about that couple 10 minutes, and in 9 minutes the girl slapped the boy and they broke up. So your first couple guess is correct. If your first couple guess is correct, do you have a divine power, or do your friend who has guessed it has divine power? Is the friend really significant, or is he just significant by chance? Which type of guess is this? So actually it's just one guess correct. So you can say that there is 50% chance that this boy or girl has divine power and 50% that he is just correct by chance. So this p-value, whenever we talk, only talk about this part, how many you are significant by chance. So because only first guess was correct, you didn't take it seriously. But then he looked at a second couple in the park also, and then also he guessed 2 minutes. Only 2 minutes, and in 1 minute 50 seconds they broke up. So the second couple guess is also correct. Now do you think this person has some divine power? I hope still not, because now he is only 2 guess correct. So if 2 guess correct, the chance of really significant is increasing, and the chance that he is significant by luck, by mistake, is decreasing. Now it's 25%. So 25% can be written as 0.25, and 50% can be written as 0.5. To win your confidence now, this person guessed about me, and I said you are an idiot people, and idiot people last longer, so till 80 year you will be together, and we should say good thing about ourselves. And at 80 year, me and my girlfriend with whom I lived in live-in relationship also 4 years, and then we married, we both died at 80 year, exactly at the same time as the person guessed. So now the third guess is correct. If the third guess is also correct, now you are now having better trust on the person. He is now really significant, and the probability that he is significant by chance is decreasing to 0.12. Now suppose to win the final confidence, he made the fourth guess, and the fourth guess he said about himself or herself that I will be in love till my internship or till this next 6 months, and then after internship we will break up. So the fourth guess is also correct. Now his probability that he is correct by chance is further decreased to 0.06. But some of you who are Sherlock Holmes lover are still not trusting. So then he made a fifth guess, and for that he again went in the park, and then he looked at a couple and said 10 seconds. And just as he said 10 seconds, a slap came and the relationship ended. So now fifth guess is correct. Now can you trust? Yes, now you can trust, because again and again 5 times he is giving correct result. So the probability that it's significant by chance is decreasing, and therefore really significant chance is increasing. So this is how scientists decide that if some drug is bringing the effect again and again for 4-5 times, we can say that the drug is significant. For example, that anti-obesity drug I am talking, I took it for 1 month and I became slim like Noora Fatehi, hai na? Then Nikhil took it and he also became slim like Disha Patani. My brother Golu took it and he is also fat and he became slim like, let's say, Tamanna Bhatia or someone. Hai na? So again and again, if 4-5 people remove their 20 kg weight within 1 month, it means the drug, you can say, is really significant, because the probability of significant by chance is decreasing. So when p-value becomes 0.05, somewhere here scientists said when it will be 0.05 or less, then we can say the drug is significant. So p-value do not talk how much it is really significant. P-value only say how much it is significant by chance. P-value only talk about this. And whenever p-value is very less, then it means the drug is really significant and we reject the null hypothesis. So now let's do some question on it. I hope this concept is clear. The question is very simple, that if p-value is 0.023, that means mistake is only 2.3%, what will you do? With which option will be correct? So first thing is, if the p-value is 2.3%, p-value is a mistake like alpha error. So p-value or alpha error is less, you can trust the result study is significant. And if study is significant, it means null hypothesis is wrong. So we have to reject the null hypothesis. So correct answer will be option B. We have to reject the null hypothesis because the study is significant. Okay. But in the same question, if they have given p-value equal to 0.23, then the mistake is 23%. And if mistake is so much, we can say study is non-significant. And whenever study is non-significant, it means that's what null hypothesis say, that we don't reject null hypothesis. So I can say we accept null hypothesis. If there is too much mistake, then we say study is useless and we cannot reject the null hypothesis or accept it. But here, if the mistake is too less, study is significant and we reject null hypothesis. I hope it is clear. Then let's do one more question on this pattern, that if the p-value is 0.05, but in reality the drug is not statistically different from the previous drug, which error is done in this study? So what is happening here in this study is p-value is coming 0.05. P-value is 0.05 means researcher has brought the result and researcher said drug significant. Researcher is saying drug is significant, but in reality drug is not significant. So you are saying drug is significant, in reality it is not significant. It means the researcher is giving which type of result? He is giving false positive result. He is saying that my drug is significant, but actually it is useless. So this type of error is alpha error or type 1 error. So this is example of alpha or type 1 error. I hope it is clear. If not, let me create one more example for you. Suppose Nikhil want a party from me today. So he came to me, auscultated my abdomen and say, Mubarak ho sir, congratulations, you are pregnant to me. So what Nikhil is doing? Nikhil is saying that my abdomen is significant. But माँ कसम मैं pregnant नहीं हूँ, and in reality I am not pregnant. My abdomen is not significant. This is just gas and fat. So what Nikhil is doing? He is giving a false positive report for my pregnancy. So this is the same thing happening here, and this is the same thing which happened in coronary drug trial when the drug was actually not significant, but researcher said it is significant. So that is when the researcher tried to overestimate the drug, giving false positive report. That is alpha error, that is p-value. Okay. Now what is this 1 minus alpha error? 1 minus alpha error is confidence of a study, and 1 minus beta error is power of a study. So let's learn about these two things also. मैं अगर आपसे पूछूं कि आपका दोस्त भरोसे वाला है या भरोसे वाला नहीं है, do you have confidence, do you have trust on your friend, or you have no trust on your friend? तो ये डिपेंड करेगा कि आपका दोस्त फेंकता कितना है ना. It will depend on how much lie your friend say. If your friend say too much lie, you will have less confidence. So more lie, more alpha error means confidence will be less. Okay. Like, can you have trust on coronary trial? No. Why? Because the alpha error was too high. So the confidence will be less. And then power of study is 1 minus beta error. So if I ask that, let's say, how many of you can get more than 60% marks in your exams. So 80% said yes, I can get, and 20% said no, no, we may not get 60%. So the reality is, if you keep working on yourself, of course, it may take some time, but all of us can get more than 60%. All of can be in the topper with time if we are interested in a study and we have confidence on ourselves. So those 20% who said I cannot do, they are doing too much beta error. They are underestimating themselves. And when you underestimate yourself or improve the beta error, power of study will decrease. So what is power? Power means ability to say significant as significant. And actually, you all are significant because we all have same memory. How? If you don't have hypothyroidism or some cretinism or some issues like that, Down syndrome and all, most of us have same memory. Why? Because we can still remember our childhood movies which we have seen 15-20 years back. So memory is not the problem. Problem is interest. So actually, we all are significant, but only some of us, 80%, can say yes, we are significant. So those 80% who can say yes, I am significant, they are powerful. Why they are powerful? Because they stop underestimating themselves. They are not doing beta error. The day you stop underestimating yourself, your power will increase. So this is two things, power and confidence. They are not mistake. They are good thing. We should be having power and we should be confident on ourselves. If you want to increase both power and confidence, what can you do? You can increase sample size and you can also increase the association. By increasing sample size and association, you can increase both power and confidence. For example, that anti-obesity drug which you have found, if you gave to 20,000 people and all of them lost 20 kg weight in just 1 month. So because you gave it on 20,000 and all become slim, your sample size is big, you can have confidence on that drug. And because all of them become lost 20 kg in 1 month, so association was strong. That's how you can say that power and confidence both are there. If the drug is trial on many people and everyone get cured within a 1 month of time, it means this drug is powerful and you can have confidence on the drug. Similarly, for your IMNCI or NEET or MCI, whichever exam you are going to give, if you do many previous year question bank, let's say you have done 8 to 10 year, 8 year at least previous year question year wise with explanation, with topic, and it's better to do it year wise, then all the subject will be in touch. So if you do 8 year PYQ year wise, these are the PYQ and their topic from which real exam question come. So they are associated with real exam. And also, if you will do the PYQ, your sample size will increase. You will know what is your score coming and you can work on improving it. You can know which area they are asking again and again and you need to focus on those areas. So by doing 8 year PYQ, your sample size and association will increase and therefore you will have more power and confidence in clearing the exam. Always in the last days also do PYQ with topic year wise, and if you will do it, your score can actually jump a lot. So this is the concept of p-value, alpha, beta error, power and confidence. I hope it is clear. Please do give me any question which you are finding difficult to solve on p-value and all, and we can solve it here online. If you have any doubt, any question, feel free to write it on the YouTube also. Now let's discuss about parametric and non-parametric test. It's actually very simple, just a new thing, so we find difficult, but it's very simple. Suppose I am measuring a score of 10,000 students. So some student will score low, some will score high, majority will be in the center. And this is what happens if the sample size is large. If you are measuring marks of 10,000 people or height of 10,000 people or weight of 10,000 people, all of it will come in normal distribution. Because when it is large people, some will have less, some will have high, but majority will be in the center. Okay, so this is known as central limit theorem. Central limit theorem means if sample size is large, distribution is always normal. Okay, now good morning Himalayan, Amit, Swastik, John J, and Sonam Subhadras. Very good, you all are answering also, and you have answered that answer B and C. Very good. Yes, very good. So if you have any doubt, this active group is there, so do participate there and keep putting your question. Now, what is non-parametric test? Non-parametric test is usually applied on a small sample size. Suppose I want to know marks of just 3 or 10 students. So maybe all these 10 students are topper and everyone marks will come very high and the curve will be skewed. Or maybe all of these are just new student of who started studying and all of them score very low, and this again the curve will be skewed. So if the sample size is small, curve is skewed, and on a skewed curve we apply non-parametric test. But if the sample size is large, it is normal distribution, and on normal distribution we apply parametric test. Now let's go into more detail of it. As I said, parametric test has normal distribution, and usually it is for quantitative data. What are quantitative and qualitative data we will read in detail, but when I talk about weight, height, BP, all of these are quantitative, because quantitative means continuous. There must be no gap between them. Like when you measure my weight, it can be 93.1, 93.2, 93.3. So weight is continuous. And on quantitative, we apply which test? Parametric test. But if it is qualitative data is those data which is not continuous, which has gap in between them. So we call it discrete or categorical. For example, when I talk about any disease, like I talk about my obesity, so you cannot say that, sir, you are 2.8 obese or 2.9 obese. You cannot measure the obesity. आप बस ये कह सकते हो कि मोटा टू थोड़ा मोटा है, बहुत मोटा है, फटने वाला है. You are mild obese, moderate or severe obese. So obesity is just category, qualitative data, categorical data. And there is always gap between mild, moderate, severe obesity. So whenever you talk about any disease, this is categorical or qualitative data. And whenever you talk about the parameter which we measure in the disease, this is continuous. For example, when I say hypertension, diabetes mellitus, these all are qualitative. But the BP which we measure, blood sugar which we measure, these are quantitative. BP is quantitative because we can measure it. Hypertension is categorical, qualitative, because hypertension is present, absent, or mild, moderate, severe. These are always category. So disease are always qualitative, and the data which is measured in those disease, they are quantitative. Very common area of question. I hope you will remember. So remember, if it is parametric test, it will be on the parameter which we measure in the disease. If it is non-parametric test, it is for categorical data. Now go into one more point, detail of it. When it is parametric test, P for parametric, P for Pearson correlation. So Pearson correlation we found in which test? Parametric test. What is this Pearson correlation? Very simple. Correlation simply means what is the direction of association between two variables. For example, suppose I am talking about amount of alcohol in your blood and chance of accident. So of course, when alcohol amount will increase, accident chance will increase. Because alcohol is a depressant, it will depress the reflux and accident can occur. One time I remember I drink too much alcohol that in the car I slept and my car banged on the truck in front of me. So definitely, if your alcohol will increase, accident will increase. This is showing relationship, the direction of association. And here the direction of association is positive because they both are going in the same direction. And this relationship is linear. So when we talk about Pearson correlation tell about linear association. Like here it is linear positive association. So linear association is by Pearson correlation. But when we talk about, and it's so easy to remember, P for parametric, P for Pearson. But when it is non-parametric test, in non-parametric test, we have Spearman correlation. And Spearman correlation is always finding association for qualitative data. And it tells us relationship between two variables, out of which one should always be qualitative. And when we talk about Spearman correlation give monotonic relationship. Spearman talk about monotonic relationship. What is monotonic relationship? Let me explain with a very good example. Suppose I am talking about obesity with BMI in WHO Asian classification. So in Asian classification, till BMI of 18.5, you are malnourished. So here you are malnourished till 18.5. As soon as it crosses 18.5 till 22.9, only till 22.9, you are normal. As soon as it crosses 22.9 till 24.9 or till 25, I can say, you are pre-obese. And as soon as it become more than 25, you are obese. So this is the actual classification of Asian WHO BMI, and you should remember this point also. They can separately ask till 18.5 to 22.9, only this part is normal. So what is happening here? Suddenly it is changing the category. This type of relationship is monotonic, and all this data, obese, pre-obese, normal, malnourished, these all you can see is qualitative data. So when we talk about non-parametric test, this type of curve can come. This is Spearman correlation for non-parametric test, and Spearman correlation only talk about qualitative. At least one out of the two should be qualitative data, and this is monotonic relationship which you can find here. Okay, so do remember this point: P for Pearson, P for parametric, and parametric is for quantitative data, large sample size which are normally distributed. Spearman is for non-parametric, which is for small sample size, qualitative data. Now, which type of tests are parametric test? So there are 4 tests which are parametric test: paired, unpaired ANOVA, and unpaired t-test is known as JET test also. So these only 4 are parametric: paired, unpaired, ANOVA, and JET test. Rest all tests are non-parametric. So there is a big list of non-parametric tests which also include chi-square test. So once they ask which of the following is a non-parametric test, option are Friedman test, paired, unpaired, or JED. So of course, paired, unpaired, JED, all are parametric, and this Friedman test, this become non-parametric. So these all tests are non-parametric, and only 4 tests are parametric. Now we have to understand that in which condition we apply which test. So remember, my friend, if the data is qualitative or categorical, in that case, in 99% time, we apply chi-square test. Chi-square test can be written as like this or chi-square like that. Hai na? We can also apply sign test and all, but till now in IMNCI and NEET, no question has came on sign test or Kruskal-Wallis test or Wilcoxon rank sum test or Friedman test. All those non-parametric has not been asked till now, but still, if you wish, we can discuss that topic also. But when it is quantitative data, then we apply parametric tests like paired t-test, unpaired t-test, JET test, and ANOVA. And what are quantitative data? So just guess. If I say cholesterol we can measure. So cholesterol become quantitative. Now I have one question from all of you. Where will you put the refractive error? Okay, the vision which you have can be low vision or moderate or severe low vision, or can have social blindness or economical blindness like that. So for which you wear a refractive error glasses. So this refractive error, is it quantitative or qualitative? Refractive error is a disease. So where it will go, quantitative or qualitative? Do answer it in the group. And I hope you can answer it, because when I talk about anemia being the disease is qualitative. Anemia is not quantitative. The hemoglobin which we measure in anemia, that is quantitative. Anemia disease, all disease come under qualitative. Okay. And when we talk about disease are represented in percentage or proportion. For example, I can say that in this class, 70% female are anemic. This is obviously the data for the whole India almost. 70% are anemic. So 70% anemic means 70 out of 100 are anemic. And this percentage or 70 out of 100, this is 70% or 70 out of 100 is proportion. So percentage and proportion we use when we are talking about anemia or disease like that. So always remember, if in the question they use the word percentage, proportion, or any disease,
answer will be chi-square 99% of time. Plus one more thing you should know, when we talk about median and mode are for qualitative data. Again and again asked in INCT exam. Median, mode, qualitative. But if we talk about mean or average, mean is for continuous data. For example, I can measure the mean hemoglobin of the class. Average hemoglobin I can measure. So hemoglobin, cholesterol, they all are quantitative, and all disease are qualitative. So let me see what is your answer for refractive error. Remember, in the refractive error category, very good. You all found it correct. Amit Sam, Praveen, Mayur Patil, Swastik, and all of you have write it correct that when we talk about refractive error is the disease. So refractive error is qualitative. The power of eye which we measure is continuous. So power of eye is continuous, but refractive error being the disease is qualitative. So this is one category which you have to know to decide which test is done. But under the qualitative data, there can be nominal or ordinal data. Or what is nominal, what is ordinal? Very simple. Nominal means there is no order, just name. For example, if I ask about your sex, you can say, sir, done it, not done it, or male, female, transgender. So it's just the name. You cannot arrange them. There is no comparison between them. You cannot say that male is stronger than female, because it all depends on your diet, skill, nutrition, your training. And anyway, female has much more stronger mental strength than male. That's why in 99% of addiction center, it's only male. Very rarely you can find female as severely addicted, very less, because they have good mental strength also. So male, female and all these are just nominal data, just name. We cannot arrange them. Similarly, if you can arrange them, it become ordinal. And this question come again and again. Glasgow comma scale, APGAR score, child book criteria, all depression scale, anxiety scale, all scale and score are ordinal. So if they use the word any score, any scale, answer will always be ordinal, because we have forcefully put a number on a pain scale, depression scale, just to arrange them in order. So all score and scale are always ordinal. Now when it comes to interval and ratio, it's very simple to understand. Interval are those variables that exist at zero. For example, many of you have felt 0 degree Celsius or 0 degree Fahrenheit in your life. And when it is 0 degree Celsius, it's not that temperature goes away. It is still palpable. You can still feel the temperature. So interval example is temperature. Because temperature do not go away at 0 degree Celsius or 0 degree Kelvin. But rest all things which are continuous is ratio. For example, if you are measuring BP of a patient and in emergency and senior asks what is the BP, you said, sir, the BP is 0. What does it mean? It means patient flied away, he is no more, or the rubber of the machine is not connected with the machine. So BP cannot be 0, height cannot be 0, weight cannot be 0, figure cannot be 0. Nikhil, is 0 figure possible? Never. Figure will be, some figure will be there. 0 figure only possible for people like me. See, 0 figure. Otherwise, all the thing are ratio except temperature. How will you remember it? Before COVID, all the major vacation of our life are summer vacation, winter vacation. So who give us interval of life? Temperature fluctuation give us interval of life. With this, you can remember interval as temperature, and rest all continuous goes in ratio. Okay. So this is the division. Now let's understand which test we can do in which condition. First is we have to compare, if we have to compare qualitative data of 2 or more group, we usually apply chi-square test. Okay, so if you look at some of the advanced book on this topic, they simply say that first classify and try to find out that in the question, what is the outcome variable, what they are comparing. And if they are comparing qualitative or categorical data, then answer will be different. If they are comparing quantitative data, answer will be different. So remember, if they are comparing quantitative, which is known as continuous, and in the question there is pre-post, before, after, or match data, then in this case pre-post or match data, we apply pair t-test. Pair t-test is pre-post or match data. What does it mean by pre-post match data? Suppose that new anti-obesity drug which you have found, you are giving on two group of people, and you are giving on them before giving the medicine, you measured their weight, and for 6 months after giving the medicine also you measured their weight. So both before and after weight are coming from the same person. So this before and after are paired, dependent on the same person. So that's why we call it pair t-test, or we call it dependent t-test. And what do you mean by dependent t-test? What do you mean by match data? Match data means you are giving it in two groups. So you gave your new drug to reduce weight in a, let's say, 40-year male, and you give the old drug also to a 40-year male. So 40-year male, they are match data. And if they are match data, it's like they're coming in pair, and we can apply pair t-test. So if it is pre-post or match data and quantitative data, we apply pair t-test. Similarly, if it is qualitative categorical data and pre-post or match data, we apply sign test. So sign test is same as pair t-test. Then if it is two groups and the data is not measured before after, like you are giving the anti-obesity drug, but you are not measuring the weight before giving medicine. You are only measuring the weight 6 months after giving your anti-obesity drug. So here pre-post is not taken, before after is not taken. And there is two group. Which test you will apply? Unpaired t-test. This unpaired t-test is also known as student t-test. Student was the name of the scientist actually, and not, it is not, I thought it is on the name of a student, but it's just the scientist. And we can also call two group as independent. Why? Because this time the weight is not coming before and after from the same person. So it is independent, unpaired, or student t-test. And similarly here, if it is two group, we usually apply chi-square test. Usually. But other test which can also be applied for two group is McNemar test. If the data is dichotomous, yes, no, like that data, we usually apply McNemar test. Similarly, there can be other tests for two group like Wilcoxon rank sum test or Wilcoxon rank sign test. But they have never been asked, so I'm not going into detail of that, but you can apply. If there is three or more group, then for three or more group, we apply ANOVA. Full form of ANOVA is analysis of variance. But if it is qualitative data, categorical data, and there is three or more group, we can apply Kruskal-Wallis test. We can apply Friedman test. So what is the difference, Friedman and Kruskal-Wallis? See, Kruskal-Wallis is when the data is unpaired. Friedman is when the data is paired. And we can apply sign test for one group also. So for one group, we can apply sign test. For paired data, we can apply sign test in one group. And if there is three group and the data is paired, we apply Friedman. If the data is unpaired, we apply Kruskal-Wallis. But in some cases, in three group, we can also apply chi-square test, very rarely, but we can apply. So usually now in IMNCI and NEET exam and MCA exam, if they are asking qualitative, they will not put the option of sign, Kruskal-Wallis, Friedman. They will only put chi-square as the option, and mostly for qualitative data answer you can simply take is chi-square. But for quantitative, these three are being asked. So if in the question you found the word pre, post or match, only then you will answer pair t-test. If you found the word before, after, pre, post or match, only then pair t-test. If two group, unpaired, three or more group, ANOVA. So let's do some question on this topic. It will further clarify this concept. This is a question came already that there is three group of people, JR, SR and intern, and you are comparing effect of yoga on the percentage of infection among the three group. So which test you will apply? So to answer such question, what you have to see is after what is written? After written percentage of infection. So this is the outcome variable which we are comparing in three group. We are comparing percentage of infection. Now, if you are looking at percentage of infection, just decide which type of data is percentage of infection. Is it quantitative data or qualitative data? And your answer will be clear. So you give me the answer. What is there? Pair t-test, unpaired, chi-square, or ANOVA? What is the answer? Paired can never be the answer because they have not given pre, post, before, after or match word in the question. If those words are not there, paired is gone. Unpaired can also not be the answer because there is 3 group. Unpaired is only when there is 2 group. So what is the answer? Chi-square or ANOVA? It all depends which type of data is percentage of infection. So if we are talking about infection, can you measure infection? Of course not. You cannot say to the patient, hey, you are looking like 2.8 infected. You can only say that the patient has mild, moderate or severe infection. So infection is categorical data. Second thing, the data is in percentage, and percentage proportion is for qualitative data, categorical data. And whenever the data is qualitative or categorical for 2 or more than 2 group, we can apply chi-square test. So answer is chi-square test. When in the same question, one more hint is given that it's a bar diagram which is used for qualitative data. So if it is qualitative data, any disease or infection, percentage is given, answer will become chi-square. Now, if in the same question, rather than asking effect of yoga on infection, if I ask effect of yoga on C-reactive protein level, now CRP is something which is quantitative. We can measure CRP. And if it is a quantitative variable and we are measuring it on JRSR 2 group, not before, after, just 2 group, which answer will be there? 2 group quantitative, very good. The correct answer will be unpaired t-test. Now, if I am measuring effect of yoga on CRP level of JRSR in turn, now there is 3 group and data is quantitative. Now we can apply ANOVA. And if we write effect of yoga on the inflammatory marker C-reactive protein before and after yoga, before and after is written, so answer will be paired t-test. Okay. So like this, we decide which test to apply in which condition. Now, let me give you one more question from this topic. Suppose they ask effect of IFA, iron folic acid, yes, no, on birth weight of newborn can be estimated by which test? Compared by which test? What will be the answer here? What will be the answer? Option are the same: paired, unpaired, chi-square, ANOVA. Same 4 option. What is your answer? C. Paired, unpaired, chi-square, ANOVA. So to decide this, the first thing you have to do is just look after on whatever thing is written. This is the thing which we are comparing. This is the outcome variable which is compared. And this variable birth weight, can you measure birth weight? Yes, we can measure birth weight. So birth weight is the thing which we are comparing and it is quantitative. So because it is quantitative, chi-square is gone. Chi-square can never be the answer. Second thing, you have to see in the question, have they written the word pre, post, before, after or not? Pre, post, before, after is not written. So paired t-test is also gone. Now the answer can be unpaired or ANOVA. And you cannot measure birth weight before birth. So birth weight can never be pre, post, before, after. So paired is gone because it's not pre, post, before, after. Chi is gone. Chi-square is gone because it's measurable quantitative data. Now you have to see whether there is 2 group or more than 2 group. If it is 2 group, answer will be unpaired. More than 2, answer will be ANOVA. So here they have written yes, no. Yes, no means one group are getting iron folic acid, one group is not getting iron folic acid. So there is how many group? 2 group. Quantitative data and 2 group. What will be the answer? Answer will be student t-test or unpaired t-test. Do you agree? So this is how we decide. But rather than 2 group, if they have 3 group, answer will become ANOVA. Now, in the same question, suppose they change the language of question and they ask it like this: effect of IFA, yes, no, on percentage of low birth weight baby. So if they say percentage of low birth weight baby, low birth weight is a category. Low birth weight is present or low birth weight is absent, or low birth weight, very low birth weight or normal birth weight will be the 3 category. So low birth weight is a categorical data and they have used the word percentage. Which test you will apply? Now you will apply chi-square test because this time the data is qualitative.
Okay, so I hope these questions will not confuse you, and this question are coming in almost every exam, whether it's INCIT, NEET or MCI. Every exam is asking question on this topic. So I hope this explanation make it simpler and you can do it correct. If still you found some difficulty, you can always ask it to me. So these are some of the topic which you should know, but let me add one more thing here. In some of the question, they put in the option jet test, and in some cases, rather than putting chi-square test in the option, they put Fisher exact test. So you should know what is this two thing. Remember, my friend, Fisher exact and chi-square are the same thing. Jet test or unpaired t-test are the same thing. So what is the difference between them? The difference is we apply jet. Achha, tell me one thing. Which come first in your life? F came first or X came first? Or alphabetically also, F occurred first or X came first? Of course, F is the first alphabet. So when sample size is less than 30, or when any of the one part of the table has less than 5 value, like here 2. So less than 5 value or sample size less than 30, we apply Fisher test. But we apply chi-square when sample size is more than 30 and when every table has more than 5 value like 6, 8, 7, 9, then we can apply chi-square. So chi-x came late, so sample size bigger. F came first, so sample size less than 30. Similarly, in unpaired, U come first, Z come late. So unpaired is when sample size less than 30, Z is when sample size more than 30. And in none of the question on this topic, they give sample size. So Fisher test or jet test is never going to be the answer. They are always given in the option just to confuse you. Never be confused, they are never the answer. Answer is either unpaired or chi-square, and you know the criteria based on which we decide this. Okay, so that's there. Now let's read about mean, median, mode. I hope you already know, but there's a trick and there's a good question on this topic which I will discuss also. Mean is average, but the problem with mean is that if there is a big number, mean get deviated towards big number. So you can say mean is mean minded, and if there is a big number, the average will get deviated towards big number. So you always have to see that in the sequence, is there is a big number. If there is a big number, mean cannot be used as measure of central tendency. Central tendency means what is in the center. Median बीच का है. Median is always in the center. Median is not affected by big number. Median always remain between mean and mode. And mode, some good book has written mode as model. Just like model want to keep itself repeating again and again, similarly mode is the most commonly repeated number. So they can ask in exam to find mean, median, mode of a data also, and it's very simple to find. If suppose the data is 2, 2, 4, 5, 6, 99, then in this case, what is the mode? Very simple. 2 is repeated again and again, so mode became 2. But is 2 in the center? No, 2 is at one corner. That's why mode is least commonly used, because mode, just like model, can go anywhere. So least commonly used is mode. Now, what is the median of 2, 2, 4, 5, 6, 99? You cannot find a middle number here, but 4 and 5 both are in the middle number. So if there is no middle number, you have to take the average of middle two number and it will come 4.5. That will be the median. So median is not affected by big number, you can see, and it will be 4.5. If you have to find the mean of this distribution, mean will be, you can easily find it 2, 2, 4, 4, 8, 8, 5, 13, 13, 6, 99, 19, and 19 and 99 means 118. So it's 118. You got it after adding all the numbers. So you have to put this symbol. This is known as sign of summation, this symbol, and divided by sample size. How much is the sample size? 6. So 118 by 6 you will do, it will roughly come 20 or 19, you can say. And you can see when the result came 19, 19 is not in the center, 19 is towards 99. So this is the problem of mean. Mean get deviated towards big number. And if in this option, suppose 2, 2, 4, 5, 6 is there, and there is, suppose, one more 6. So if there is 2 times 2 and 2 times 6,
we call such distribution, let's say the distribution is 2, 2, 4, 6, 6. So what is the mode here in this? There is two mode, 2 and 6. This type of distribution is bimodal distribution. When there is two mode, we call it bimodal. And we cannot take average of bimode, and we cannot say that 2 and 6 average. So 4 is coming most commonly. No, 4 is not coming most commonly. So remember, we can take average of mean and median, but we can never take average of mode. Average of mode cannot be taken, because if in your class students are getting 30 number or 80 number, I cannot say that 55 is most common. No, I cannot take average of mode. So whenever we take mean, we first add all the number by the sign of summation, and then after adding all the number, we divide it by sample size, which is n. You can do such exercises, but let's directly come to the question. In the exam, they will create such question that 10, 12, 14, 16 and 88 are the 5 reading. If 10, 12, 14, 16, 88, then which one is better measure of central tendency? Mean, median or mode, or any one of the above? So in such question, we think mean is the most commonly used, but they had given a big number 88. And if big number is given, it's better to use median, not mean. Because mean get deviated, but median remain in the center. Now the question is, if suppose in this distribution 10, 12, 14, 16, 88, you are replacing 88 with 18. You are correcting the mistake and replacing it. So if you are replacing it, which out of the 4 is correct? And there are multiple correct answer. First thing which is definitely possible is median is always the same, 14 and 14. So median is same is correct. Now what is the effect on average? If the big number go from 88 to 18, big number decrease, of course, by obvious reason, the average or mean will also decrease. So median same, mean decrease, both C and D are correct answer. If you replace 88 by 18, mean will decrease, median will remain same. Now, let's understand about skewed curve, and then I will give a very interesting question between integration of central tendency and skewed curve concept, which came only in INCT, and I usually do not discuss it any of the class. So let's first understand what is skewed curve. Very simple thing. Skewed means stretch, टेढ़ा, क्योंकि टेढ़ा है मगर मेरा है ना, the skewed or stretch. So suppose I am taking a class test of biostat to all you people without teaching you all biostat. So most of you, let's say 30 students, suppose 30 student got 50 marks. So 50 is coming again and again in the class. And they can ask it, what is this topmost point A? Is it mean, median or mode? Remember, 30 marks is coming again and again, 50 times repeated. And most commonly repeated number is mode. So this A is mode. Again, just like a model want to maintain a top curve, mode is also always on top of curve. Like I am a model and see my curve almost top now. So do remember, mode or model always on top of curve. What is this point B? B is median. क्योंकि याद रखना, median बीच का है. Median is always in between mode and mean. And in the skewed part, you have the mean. Okay. So this is a positive skewed curve. Why it's a positive skewed curve? Because the skewed or stretch part, you can see, is between 30 to 140. Towards big number, you have the skewed or stretch part. And in your life, if you are going towards big number, big marks, big money, you are also positively skewed. So same is for the curve. If the skewed part is towards big number or right hand side, we call it positively skewed. And in a positive skewed curve, you can see mean is coming at around, something around 80. Median is coming at around 60. And mode is coming at 30. And we all can see 80 is bigger than 60 and 60 is bigger than 30. So I can say that if it is a positive skewed curve, in a positive skewed curve, mean will be bigger than median and median will be bigger than mode. This is the sequence which I used to mug up during my MBBS exam preparation, but you need not to mug up. You just need to remember that in positive skewed curve, which is greatest? In positively skewed curve, mean greatest. Mean is the biggest, greatest. If you remember this one line, mean is greatest, obviously the sequence will be obvious to you, because if the mean is greatest, who will be in the center? Median. So what will be the sequence? Mean, median, mode. And if you remember, mean is greatest in positive skewed curve, what will be greatest in negative skewed curve? Mode.
because median is always in the center. So what is the sequence for negative skewed curve? Mode, median, mean. For positive, mean, median, mode. Because in positive, mean is greatest, so in negative, mode will be greatest. Median can never become the greatest. So in this way, with one line, you can remember the sequence. Now, let me give you an example of negative skewed curve. Suppose in a hospital, most of the children are born with an APGAR score of 8. So what is this 8? Mean, median or mode? Most children are getting 8. So 8 is the mode. Now, what is the range of APGAR score? You know what is APGAR score. Now, as soon as the child is born, we start judging the kid because we love judging people. So we judge kid and we give some number between 0 to 10. So APGAR score is between 0 to 10 and mode is 8. Remember, mode is the topmost point of the curve. So if you draw an imaginary curve, it will come like this. 0 to 10 is the range and topmost point 8 is the mode. So the skewed part is between 0 to 8, which is lesser number than 8 to 10. So this is a negative skewed curve or left-hand skewed curve because the skewed part is towards lesser number. So this is negatively skewed thing, and they can ask in pedia also in the APGAR score, what is R for? R is not for respiratory rate, because if you try to measure respiratory rate in a newborn child, it minimum needs 15 seconds, and in 15 seconds, child will fly away or die. R is for respiratory effort. If the child is crying, respiratory effort is present, we give 2 number. Not crying, respiratory effort absent, we give 0 number. So we read positive and negative skewed curve. Now is the time to give you one question which totally baffled me, confused me. The question was, they had given 3 normal curve, 1, 2, and 3. These are 3 different curves. And sorry, let's make it like this. Okay, so yeah, like this. And here, this is curve number 1, 2, and 3. They are not the same curve. If you look at the center point here, it is 2. Center point of second is 4. Center point is 6. So in case of curve 1, 2 is the mean, median, and mode because it's a symmetrical curve. So middle point is the mode, 2 is the mode, median is 2, and mean is also 2. So in the first mean, median, mode, all are 2. In the second mean, median, mode, all are 4. In the third mean, median, mode, all are 6. So these are the 3 different curves. They ask which is correct. Okay, which is correct? Option A. Does the correct answer is mean is equal to median, but mean and median are not equal to mode. And when they are talking mean, median, it means they are saying average mean, average median. Hai? Average mean is equal to average median, but average mean and median is not equal to average mode. That's what they want to ask about the 3 curve. Second option was that mean is equal to median and mean and median are equal to mode also. They all are equal. The third option is that mean is not equal to median and median is not equal to mode. So which out of the 3 they ask is, do you think is correct? So the point is, as I said, the average mean of all the 3 curve is, of the first curve, the average mean is 2, second curve is 4, third curve is 6. So average mean of all the 3 curve is 4. Average median, middle point of all the 3 curve is also 4. But we cannot take average of mode. Mode average cannot be taken, and these are 3 different curve. So it's 2, 4, and 6. Average mode not possible. And actually it's 3 different mode for 3 different curve, 2, 4, 6. We cannot take average of mode. So therefore, average mean, average median will be equal, but they will not be equal to mode because average of mode cannot be taken. For example, if you look at this non-Hodgkin lymphoma, maybe I can have some mistake, but usually non-Hodgkin lymphoma peak between 15 year one time, around 15 year it peak, and then again it peak at around 55 year. So you cannot take average and say that non-Hodgkin lymphoma most commonly occur at 30 year.
You cannot say that it is average is, let's say, what is the average of 15 and 55? 15 and 55 average is, let's say 32.5 or something. So you cannot take the average and say that most commonly non-Hodgkin occur at 32. There has to be two mode, and we cannot take the average here. So this type of distribution is bimodal, and if the distribution is bimodal, average of mode cannot be taken. So average mean, average median are equal, but they are not equal to average mode. Okay, chalo. Now let's continue with this question of a skewed curve in a very interesting way. Sometime what they do is they give a box and whisker plot and they put some dots here and there. So this is a box, and in a box and whisker plot, box is between 25% to 75%. After this box, there is the tail, pochi. We call tail as whisker. So this is box and whisker plot. And what is the role of box and whisker plot? Box and whisker plot help us to identify outlier. These extreme value are outlier. Outlier. For example, they do a survey in UK population every 2 to 3 years that how many sexual partner you had lifelong. And average usual answer came is 2 to 7. 2 to 7 sexual partner lifelong. But in the same UK population, kuch sikari log, some hunter, they give the data that they had 499 sexual partner, 699 sexual partner. So should we include those hunters data in normal population? No, we should never include those data in normal population, because if you include those data, average number of sexual partner in normal population will increase to 17 or 20, and then the whole population will think that everyone is doing, we are not doing, and they will get depressed. So we have to remove those 499, 699 data by calling them outlier. And who help us to decide outlier? Box and whisker plot. So outlier is just the position of the data, that it is very out, and the outlier also tell about position of data. So in this box and whisker plot, if I draw an imaginary line in the center, then 50% data will be this side, 50% will be this side, and we call it as a normal curve. Normal curve. But what they ask in exam is, they will give you a box and whisker plot, and they will not put the danda or the bar in the center, they will put it at the lower half or upper half. So if it is put at lower half, is it positive skewed curve or negative skewed curve? They will ask. Which type of curve is this? So to answer it, you can draw an imaginary curve here. And if you draw the imaginary curve, between 25 to 40% is the straight part. And between 40 to 75%, this part, 40 to 75, they have the bigger number. So towards bigger number, you have this big part, skewed part. टेढ़ा वाला हिस्सा बड़े नंबर की ओर है, because skewed part is towards bigger number. So what will you call it? In your life, if you are going towards bigger number, positive skewed. So similarly here also, skewed part towards bigger number, we call it positive skewed curve. And if they draw a box and whisker plot with bar above, we call it as a negative skewed curve. So I was taking this class in Jaipur, and a student came in the lunch and he said, "Sir, I will explain this concept in such a way that none of the class will ever confuse." I said, "Tell me." He said, "Sir, very simple. Take this bar as thought of sex. When the thought of take this bar as penis or thought of sex. When the penis is below the belt, thought of sex is under our control. Then we can focus on study better. Our marks will increase, and we will go positive in life." So this is positive skewed curve. But when the penis or thought of sex is every time in the brain, then we cannot focus in study, our marks go low, and we are negatively skewed in life. So याद रखना, डंडा नीचे, positive skewed curve. Danda sar mein, negative skewed curve. If the bar is below, it's positive skewed. If the bar is towards the upper side in the head, we call it negative skewed curve. And I said, "Very good, brother. You gave me such a good idea." And using the same idea, I remember the most toughest formula of my life. That is the formula of positive likelihood ratio or negative likelihood ratio. In both the formula of positive and negative likelihood ratio, we always write sensitivity above and specificity below. So always sensitivity is above, specificity is below. But the difference is, remember, when the danda was niche, our focus was on study, because penis is under control, thought of sex is under control, we go positive skewed curve. Similarly here, if the danda is niche, one minus sign is below, we call it positive likelihood ratio. And if the bar or thought of sex is always in our head, then we cannot focus in a study and we go negative skewed. So similarly, if you put one minus sign here, this becomes the formula of negative likelihood ratio. So with the same concept, we can also remember this toughest formula: bar below positive, bar in the head negative. Okay, I hope you will remember it. If you forget, I will hit you with a bar. Okay, don't forget. Okay, so this is positive and negative skewed curve. I hope you will remember it. Now let's talk about measure of dispersion, a topic which we think is very tough, but is actually very simple. एक ही बात बताओ, रायता कैसा पसंद है आपको, कटोरी वाला या टेबल पे फैला हुआ? Which type of curd you like, in katori or spread on table? Of course, in katori, because if it is spread on table, how will you eat it? Very difficult to eat. So whether it's curd or it's data, we always want it to the point. We want dispersion to be less. Less is the dispersion, better is the quality of data. And to measure the dispersion, we use range, mean deviation, variance, standard deviation, and the last thing we measure is standard error. So these 5 things tell about measure of dispersion. Now, to understand this concept better, we can use an imaginary situation. Suppose I am going to give you a big party after the class. Suppose is the main word. And in that party, there is all kind of drink. So how much is the minimum and maximum which you can drink? That is the range, maximum minus minimum. So maximum one can drink is 4 liter. Of course, 4-5 liter, you cannot drink more than 5 liter. And then lowest you can drink is 100 ml. Because there is every kind of drink, vodka, brandy, wine, cold drink, coconut water, flavored milk, water. So at least you will drink 100 ml even if you are non-alcoholic. So 5 liter to 100 ml is the range. Now, and this has been asked in INCT, maximum to minimum is the range. Because if you do minimum to maximum, answer will come negative. So the question is that if I arrange 5 liter for all of you, there will be a lot of wastage of drink. And if I arrange 100 ml for all of you, you will beat me badly. कि अगर मोटे औकात नहीं थी तो बुलाया क्यों, है ना? If you don't have the money, why you ask us to come for the party? So this range is not giving us any idea how much you will drink. If you really want to know the drink capacity, the real amount of drink, I can ask it from all of you and then take the average. But it will waste a lot of time. So what I can do is, from the class of let's say 100 students, I will randomly choose a sample of 3 people. And I will ask from those 3 people, how much will you drink? So suppose I choose 3 people. First person said, "Ki sir, I will drink 500 ml. Second said, I will drink 1 liter. Third said, I will drink 1.5 liter. So this is the 3 answer which I got. Now in this data, what is the average? What is the average of 500 ml, 1000 ml and 1500 ml? 1500 ml and 1000 ml. What is the data average? 500, 1000, 1500. Of course, the average will come 1000. You can measure it also. 500 plus 1500 is 2000, 2000 plus 1000, 3000, 3000 by 1000 will come 1000. And without calculation, I can say that this 1000 ml is the mean of the sample, average of the sample. Why I can say without calculation? Because it is a symmetrical data. हर नंबर जब बराबर दूरी पर होता है तो बीच का नंबर ही मीन होता है. If every number is at equal distance, then middle number is the mean. So such data is symmetrical distribution. So here mean of sample is 1 liter. And how far is each of the number from 1 liter? Each number is away from the mean by 0.5 liter or 500 ml. So this 0.5 liter is the mean deviation. देखो नाम से ही clear है. Mean deviation का मतलब हुआ कि हर एक नंबर कितना डिविएटेड है उसका एवरेज. और हर एक नंबर आप देख सकते हो 0.5 लीटर दूर है बीच वाले से, तो मीन डिविएशन 0.5 है. मीन डिविएशन मीन्स हाउ फार इज each number away from the mean, and you can see each number is away by 0.5 liter, so mean deviation is 0.5. And the same concept is for standard deviation. So standard deviation is not a very big or tough thing, it's a very simple thing. Standard deviation means how far is each number from the sample mean, and here each number is 0.5 liter away, so standard deviation is 0.5 liter. How you found this mean deviation or standard deviation? To find the mean deviation, first you have to write the mean. Mean is written as this sample x bar. Then you have to subtract one by one each number you have to subtract from the mean. First, and number is written as mu. So first you will find the mean, then you will subtract the number from the mean, and you will add all of them. This is known as sign of summation. So to find the mean, we write x bar, and then from the x bar we subtract each of the number. So x bar minus mu, minus each number, and after subtracting the number we divide it by sample size n. So कुछ नहीं है, सिंपल सी बात है यार. मीन डेविएशन निकालना है कि हर एक नंबर 20 से कितना दूर है, तो हर एक नंबर को एक बार 20 से माइनस करोगे और फिर उसका एवरेज निकाल लोगे. To find the mean deviation, that how far is each number from the mean, we subtract all the number from mean one by one, and then we take their average. So when you are trying to find the mean deviation, we don't just put n below, we put n minus 1. Why we put n minus 1? Because this is known as degree of freedom. What is degree of freedom? Simple thing. If I have 5 fingers, out of 5, what is my freedom of selection? How many I can choose out of 5? I cannot choose all 5. I choose 1, 2, 3, 4, 5. 4. When there is the last finger left, and it's not the middle finger, when the last finger is left, there is no freedom of selection left. So out of 5, I can choose only 4. That's why we do n minus 1 as degree of freedom. Okay? And not everyone has 5 fingers. My girl child Prisha Lakshmi had these 2 fingers joined together. So if Prisha Lakshmi will grow up and say fuck off to the world, she will say like this, fuck off. So do remember, if she had 4 fingers, how much is degree of freedom? Her degree of freedom is only 3 out of 4. She can choose 1, she can choose 2, she can choose 3. If the last finger left, she don't have the freedom of selection. So degree of freedom is always n minus 1, and this is the simple formula of mean deviation. But if you try to find the mean deviation with this formula, what is the mean of our question? Our question mean is 1 liter. So first you will subtract 0.5 from 1 liter and put this special type of bracket. Then you will add subtraction of 1 from 1.5 and put this type of bracket. And there are 3 people, so sample size is 3 minus 1, that is 2. If you try to solve it, mean deviation will come 0.5 minus 0.5 by 2. So it will come, answer will come 0. Because here 1 minus 0.5 will be 0.5, 1 minus 1.5 will be minus 0.5. So this minus and plus will cancel each other, and mean deviation will come 0. Is it correct answer or is it wrong answer? Definitely 0 is not the correct answer, because all 3 numbers are different. If all 3 number is 1 liter, 1 liter, 1 liter, then mean deviation will be 0. But here the number are different, and we can clearly see mean deviation is 0.5 liter. So this answer is 0 is wrong. Why wrong answer we are getting? Because minus plus sign are cancelling each other. Till they keep cancelling each other, our answer can never be correct. So you have to remove the minus sign to get correct answer. And how can you remove the minus sign? One rule which we put in maths in board mass is that there is a flying arrow which come, not flying arrow, but flying bracket which come, and it remove the minus sign. So in mean deviation, we have that special type of bracket, and due to that special type of bracket, minus sign goes away. And if minus sign goes away, 0.5 plus 0.5 is 1 by 2, and 1 by 2 will be 0.5, which is the correct answer. Mean deviation is 0.5. So one method of removing minus sign is by putting that special bracket. What is the other method of removing minus sign? The second method of removing minus sign is by doing a square, because minus into minus will remove the minus. So when we find variance, in variance, we are doing the square to remove minus sign. So what will be the formula of variance? Mean deviation formula, we just have to put a square and it will become the formula of variance. So for variance, we write mean minus number whole square by n minus 1.
This is the formula of variance. We are just doing a square because minus minus will become plus. So we are doing a square in variance. But if you do square, the result will also come in a square. And we don't want it to have the result in the square. So to get the correct answer, you have to remove the square. And how can you remove the square? By doing under root. That is why standard deviation is under root of variance. And what will be the formula of standard deviation? Standard deviation formula will be under root mean minus number whole square by n minus 1. And we put this symbol as a sign of summation. So in IMNCI 2 exam in last 4 years, they have asked you just to identify this correct formula of standard deviation. They just ask you to identify this correct formula of standard deviation. And this correct formula of standard deviation is very easy to identify if you understand this 3 character of this story. What are the 3 character of the story? The first character of the story was that degree of freedom is n minus 1. Second character was to remove minus sign, we did square of mean minus number. And the third character was to remove square sign, we did under root. So they never gave numerical on this formula, but they ask you to identify the formula, and you can easily identify it if you remember this 3 character. So do remember what is the formula of standard deviation? Under root mean minus number whole square to remove minus sign and divided by n minus 1 degree of freedom. This is the formula for standard deviation, and based on this small formula they can give some numerical also, that is standard deviation is under root of variance. Okay, so this is what I tried to explain here, but do remember one more thing here. The thing is that if you have sample size less than 30, then formula is n minus 1, because till 30 removing 1 matter. See, the point is very simple. If you remove 1 from 10, it matter because you have removed 10%. But if you remove 1 from 100, does it matter? No, because if you are removing 1 from 100, you just have removed 1%, it doesn't matter. So we remove 1 till 30. If the sample size is more than 30, then we don't do n minus 1, then we only do n. So remember, for sample size more than 30, the formula is mean minus number whole square by n. So if it is more than 30, we only put n. 30 or less than 30, we put n minus 1, because subtracting 1 matter only till 30. So only till 30 it is n minus 1. After that it is just sample size n. So this formula you just need to identify, and this formula numerical can come. Standard deviation is under root of variance. Okay, so these are the measure of dispersion. And remember this point, whenever we use standard deviation is for a sample. मान लो आप 3 दोस्त बैठे हो, तो बीच वाले दोस्त से बगल के दोनों दोस्त कितने दूर हैं, वो स्टैंडर्ड डिविएशन है. If you 3 friends are sitting, from the middle friend, how far is 2 of the remaining friend? That is standard deviation. In a sample of 3 people, we use standard deviation. But in a class, in the whole population, we use standard error. So standard error is not a mistake. This is same thing as standard deviation, roughly the same thing. But standard error is for the whole population. Okay, not for the sample, but for the whole class. Now, what is this standard error? It can be calculated by 2 formula. One is under root standard deviation by n, and other formula is under root PQ by n. So why you have 2 different formula? Because data can be quantitative or qualitative. If the data is qualitative or categorical data, I told you, will be in percentage. So if the data is qualitative, percentage P will be in the percentage. For example, they gave that in your class, suppose prevalence of anemia is, or prevalence of anxiety is 10%. 10% students have anxiety. So what will be the Q? Q is 100 minus 10. 100 minus 10 will be 90%. And suppose in your class there is total sample size of 100 students. So you can find the standard error from here. What is the formula of standard error? Under root PQ by n. So what is P here? P is 10%. What is Q? 90. And what is sample size? 100. So all the 0 will cancel out. It will come under root of 9. Under root 9 means 3. So standard error will come 3. Okay. So this is the way to find standard error for qualitative data like anemia, anxiety and all. But if the data is quantitative, like hemoglobin, BP, HB, quantitative, then we use the formula of standard error. The formula is for standard error, standard deviation by under root n. For example, if in your class the mean hemoglobin is equal to, let's say, 10 and student sample is 100 and mean hemoglobin is 10, standard deviation is 1, what will be the standard error here? So here, if you want to know the standard error, you have to use the formula. Standard error is standard deviation by under root of sample size. This mean is just given to confuse you. What is standard deviation here? 1. Sample size under root 100. Under root 100 means 10. So 1 by 10 or 0.1 will be the standard error. So such a small numerical can come and you can easily calculate it. If you remember the formula for standard error is standard deviation by under root n. For data which are quantitative, measurable, average is there. And if the data is qualitative, we use the formula under root PQ by n. So this is the final 5th measure of dispersion, standard error. Now, after remembering all the 5 measure of dispersion, let's read about a standard normal curve. Again and again question come from it. There are a standard normal curve is always bell-shaped, ulta, ऐसे घंटे की तरह लटका होता है ना. So it is bell-shaped and it never touches the baseline. Why it never touches the baseline? Because probability always remain there. For example, if I ask you that how much you can run and you said ki sir I can run between 4 to 5 kilometer. So you said 4 to 5 kilometer I can run, and I will ask that how much sure you are that you can run 4 to 5 kilometers. So you said ki sir I am 95% confident that I can run 4.5 plus minus 0.5 kilometer, 4 to 5 kilometer I can run. This for this thing you are 95% confident. So this is your 95% confidence interval in simpler term. What is confidence interval? Confidence interval is that range of value within which answer lies. वो range जिसके अंदर आंसर छुपा होता है. जैसे आप 4 से 5 किलोमीटर के कहीं बीच में जाके रुक जाओगे तो आपका 95% कॉन्फिडेंस इंटरवल हो गया 4 से 5 किलोमीटर. That range within which answer like for your case, you will stop somewhere between 4 to 5 kilometer. You are 95% sure of it. So your 95% confidence interval is 4 to 5 kilometer. But you can never be 100% sure that you can run from 4 or 5 kilometer only. Suppose you thought I am 100% sure I can run 5 kilometer only, not more than 5. But at 4.9 kilometer, a dog came and sniffed something in your butt and started barking and chasing you. Then you can even run 7 kilometer. It depends on the dog now. And if you think I am 100% sure I can run 4 kilometer, but at 3.9 kilometer, you found a very good girl in which you are interested. So you will, or if you are a girl, you found a very good boy in which you are interested. So you can stop at 3.9 also. Na? In one of the class, I asked the student, ki, will you stop at 3.9 kilometer when you see the girl or not? He said, no, sir, I will not stop. I will keep running till 4. I said, okay, assume at 3.9 kilometer, your mother is standing. Ab to tera baap bhi rukega, hai na? If your mother is standing at 3.9, even your father will stop. So we can never be 100% sure that 4 to 5 is the range. Always the surety is never 100%. That's why I say it never touches the baseline, because the possibility of running is always something which can be less than 4 or more than 5. So it never touches the baseline. Now, there are 3 rules of standard normal curve which are very simple to remember actually. If you look at rule 1, this part, the topmost point, this part is the mode which is at 0. And middle number, because there are 3 number here, median is also 0. And mean is also 0. So this is rule 1. Rule 1 simply says in standard normal curve that mean is equal to median and median is equal to mode and all are equal to 0. That's what Buddha said. Nothing is everything, everything is nothing. We and nature are connected like a big zero. And if you want to feel the connection of nature, focus on your breath, go inside your body, and you may connect with the nature like a big zero. So that's the rule number one. Mean, median, mode, all are zero. Then rule 2 says that if you look at this curve, the standard, this curve will have standard deviation equal to 1, variance also equal to 1, and the area under curve is also equal to 1. So this three thing all are equal to 1. Sabka Malik ek. This is what rule 2 says, and maximum time question come from rule 2. And that's what actually Buddha said, Guru Nanak said, Muhammad Pagambar said, Krishna said in Gita, that God is one and it is present within us in the form of Atma. Krishna said, Muhammad Pagambar said it is present in the form of Ruh. And Christianity said it is present in the form of soul within us. Then Buddhism said it is present in the form of consciousness, Chetana in us. And Jainism said it is present in the form of Jinn, or the memory part or the plasma part of the body in us. So all the religion is saying the same, that God is one and it is present within us in the form of Ruh, soul, Atma, whatever you say. And we are stupid who are fighting unnecessarily that God is different and all. So that rule 2 is the rule which commonly they ask in exam also. And there is quite a debatable thing here. I just said that standard deviation is equal to under root of variance. And here I am saying it is equal to variance. So how both of it is correct? Both of it is correct if it is 1. If it is under root of 1, it will come 1. If you do square of 1, it will come 1. So only in this case, variance is equal to standard deviation because they both are 1. Okay. And this is the rule from which mostly the question comes. Rule 3 is very simple, which says that if you look at the middle part of this curve in this red zone, if the total area is 100%, this red zone, which is between -1 to +1 standard deviation, has definitely more than 50% value. Actually, it has 68% value. And if you go -2 to +2, it has 95% value. And -3 to +3 will have 99% value. This is rule 3. That mean ±1 standard deviation is 68% area under curve or 68% value. Mean ±2 has 95% area under curve or 95% value. Mean ±3 has 99% area of under curve or 99% value. This is rule 3. So let's do a very interesting question on this topic. The question is, what is the area under mean +1 standard deviation? What area will be between mean +1 standard deviation? What is the answer? 0.68, 0.7, 0.34, 0.695. Do reply in the chat box. I am waiting for your reply. If this is a standard normal curve, it is not a standard normal curve. This is a standard normal curve. They are asking, what is the area between mean +1 standard deviation? They are not asking ±1. If they ask +-1, then answer will be 68. But here they are not asking +-1. They are just asking this area, half of 68. And half of 68 is, of course, 34%. So if they ask area under mean +1, it is 32%. Area under mean +-1, 34% mean +1. And if they ask mean +-1 standard deviation, then it becomes 68%. Okay. And if they ask area outside, how much area is outside mean +-1 standard deviation? So inside is 68%. If you subtract 68 from 100, it will come 32%. So outside area is 32%, and that 32% will be 16% divided. 16% on this side, 16% on this side. So outside is 32, inside is 68, but area under mean +1 is 34%, not 68%, because it's +1, not +-1. Okay, sure. Now, what is this confidence interval? We just understood with this simple example. That range within which answer lies is confidence interval. Like your running range is 4 to 5 kilometer, so the confidence interval is 4 to 5 kilometer. If I ask how much marks you will get in exam, and you said, sir, I will get marks between, let's say, out of 200, I will get, let's say you said out of 200, I will get 130 to 140 marks out of 200. And how much sure you are? I asked
You said, sir, I'm 99% sure. So your 99% confidence interval is 135 plus minus 5 marks. Somewhere between this, your marks will come in the exam. Okay. So this is confidence interval, the range within which answer lies. It's a very simple thing. But there are two questions which came from here. These both are PYQ of NEET exam, which you should focus. Which type of confidence interval you like? The one with bigger range or the one with a smaller range? Remember, the bigger the range of confidence interval, less significant or useless the data become. Bigger the range of confidence interval, less significant data become. Less significant data become. For example, you are a post-intern or final year student, and a final year student is giving the answer that I will get between 130 to 140, 65 to 70% marks out of 200. This is final year student confidence interval. Now suppose I ask the same question from a first year student who just joined MBBS. How much marks you will get in the IMNCI exam when you will give it after 5-6 years? So the first year will say, sir, I am 99% confident that I will get between 0 to 200 marks. And so this is his 99% range, 0 to 200. Which range is better? 130 to 140 or 0 to 200? Of course, 130 to 140 is better range because it is to the point. It is giving us clear idea that this student is studying well and he can be among the topper. But when it is 0 to 200, it is giving us no idea whether he will top from the back side or top from the upper side. So this is a useless confidence interval. This is a non-significant confidence interval. Why? Because it is so big that we are unable to understand anything about the data. So remember, the bigger the range of confidence interval like this one, less significant data become if the range become big. Now the second question from this part they ask is, how can you decrease the range of confidence interval? Because we just got कि हमें confidence interval छोटा चाहिए. We want a smaller range of confidence interval. So how will you make the range small? To make the range small, increase sample size. For example, why this final year is able to say that I will get 130 to 140? Because he had done previous year questions and given some mock test and GTs also, and he found that every time his score is coming 65 to 70%. So this final year student has observed himself or herself again and again. The sample size is big, number of observation is sample size. So here the number of observation or sample size is big, so the range is small. And the first year has not done any mock test or any PYQ of PG exam. So here the sample size is 0 because the sample size is less, so the range is big. So if you want to decrease the range, increase sample size to decrease range of confidence interval, and make data more significant. What you should do, if you want to make data more significant, decrease the range of confidence interval, and to decrease the range of confidence interval, increase the sample size. Let's have one more example. You said I can run between 4 to 5 kilometer, 95% sure. This is your confidence interval range. But if you ask the same question from me, I will say कि I am 95% confident I will run between 0 to 100 meter to 5 kilometer. My range is 100 to 5 kilometer. Big range. Why? Because I have not run for many years. When only I play with my kid, then only I run. I am not running for a very long time. One time, my younger brother, they took me to cricket and I just run for 50, 100. So I can run 100 meter, but maybe I can run 5 kilometer also. I don't know, because my sample size is less, so my range is big, and my data is useless data. It is not telling you whether this person is fit or highly unfit. But 4 to 5 kilometer is giving you clear idea that the person is fit. So when the range is small, data is more significant. And why the range is small? Because this person at your age have run in past multiple times. So the sample size is more, so the range is small. Are you understanding it or not? Do remember these 2 points. It's very simple actually. When I started dating the girl with which I was in live-in for 4.5 years and then married, she used to call me at the girl hostel to come and pick at 7 PM, and I used to reach at 6:50, under excitement. And then C used to come by 7:25 or 30. So after multiple observations, multiple sample size increase, I decided that why not I directly go at 7:20, and then C will come between 25 to 30. So from 7:20 to 7:30, I have to wait only. So with multiple sample size, multiple observation, I decrease the range. Earlier my range was 6:50 to 7:30. Then after multiple observation, my range decreased from 7:20 to 7:30. And then my girlfriend used to come out so that we can go together at the flat and play Ludo together. So she used to come out and she used to ask, baby, you must be waiting for so long. Don't you feel tired or irritated by waiting? And I used to say, Arey, baby, intezar ka apna alag maja hai na. There is different fun in waiting. Give me a kiss now and let's go. Let's play Ludo together. So do remember that with observation, confidence interval range become narrow. And we always want the data which is having less dispersion, which is to the point. So this 2 question has been asked again and again. I hope it is very clear to you and confidence interval is clear to you. Remember, whenever you are calculating for a sample in the question, if population word not given, then you will use this formula that 68% confidence interval is mean plus minus 1 standard deviation and 95% confidence interval is mean plus minus 2 standard deviation, because the standard deviation we use for sample. So 99% time numerical come with this 2 formula. But sometime, rarely, they use the population word. So if they use the population word, then the formula is 95% confidence interval is mean plus minus 2 standard error. Because remember, for the population we use standard error, and 2 standard error means 2 standard deviation by under root, and this big formula will be applied if they use population word. And similarly here, for 95% confidence interval for population, we can use prevalence plus minus 2 under root PQ by N. If they use population, then we have to use the formula of standard error. If they use sample, which they will use in most of your numerical, you will use this formula for sample. Because in sample, we will use a standard deviation. In population, we will change a standard deviation with a standard error. And we just read the 2 formula of a standard error. One formula is the standard deviation by under root N. Second formula is under root PQ by N. So you just have to put one of these 2 formula in place of a standard deviation if they use the word population. If population word not given, then we use this formula. If population word given, we will use standard error in place of standard deviation, and we can apply this formula. But 95% time they will give numerical on this small formula. Okay, chalo. Now, this is inferential statistics. As I said, confidence interval we collect it for sample, apply it for the whole population. This is inferential statistics. Now, let's do some question on this topic. The question is, if average weight of a student is 70 kg, standard deviation is 10, find 68% confidence interval. This is the question for all of you. Please do it right now. And it's very simple to do, because we all know 68% confidence interval is mean plus minus 1 standard deviation. Do it now, because if you will not practice it now in the exam, you will think it's numerical and you will leave such lollipop question, which is very simple. Simple. Mean is what? 10. No, mean is 70 kg, not 10. So mean is 70 kg and standard deviation is 10. So you will not multiply anything with 10 because it's 68%, and 70 plus minus 10 is 60 to 90. So 60 to 80. So 60 to 80 is 68% confidence interval. But if they ask 95% confidence interval, 95% confidence interval is mean plus minus 2 standard deviation. So it's 70 plus minus 2 into 10. That means it's 70 plus minus 20. So it's 50 to 90. So this way you can find 68 and 95% confidence interval very simply. 50 to 90 will be 95% confidence interval and 60 to 80 will be the 68% confidence interval. Okay. Now let's do a very interesting question on this topic. They have asked the question, in our data which we just discussed, In the data, you can see this is 50 at -2 standard deviation and 90 kg is +2 standard deviation. They are asking, of course, between 50 to 90, in this middle part, 95% people come. So where the 5% student weight will be there? कितने वजन के नीचे 5% बच्चे क्लास के होंगे? At what weight 5% population will lie? 5% बच्चे कहां होंगे, ये पूछा जा रहा है. Where will 5% student will lie? Can you answer it? Please do try to answer it. Will it be 50? Will it be 90? Will it be 47, 53, 60? What is the answer? तो देखो, ये एक्चुअली एक बड़ा अच्छा क्वेश्चन है कंसेप्ट वाला. बीच में है 95%. 100 में से 95 चला गया तो कितना बचा? 2.5%. तो 50 के नीचे 5% बच्चे नहीं हैं. 50 के नीचे सिर्फ 2.5% हेयर है, 2.5% इस तरफ है. तो इसलिए 50 आंसर नहीं होगा, क्योंकि 50 के नीचे 5% नहीं, केवल 2.5% बच्चे. अब अगर तुम देखो 47 तो 50 से भी और आगे जाके आएगा. तो जब 50 के नीचे ही 2.5% है, तो 47 के नीचे तो 1% भी नहीं होंगे. तो 47 तो बिल्कुल आंसर नहीं होगा. लेकिन अगर आप 50 के थोड़ा सा अंदर आओ, जैसे ऑप्शन दिया है 53, तो अब चांस है कि 53 और 50 के बीच में आपको क्लास के 2.5% एक्स्ट्रा बच्चे मिल जाएं. तो अब कितने बच्चे 53 से नीचे हैं? देखो, 53 से नीचे हो गए 2.5 पहले से ही थे, और 2.5 आपने 53 और 50 के बीच में इंक्लूड कर लिया. अब 5% बच्चे 53 से नीचे हैं. तो जब भी आपसे पूछेगा कि 5% स्टूडेंट कहां है, 5% स्टूडेंट या 5% पॉपुलेशन होंगे जस्ट अबव -2 स्टैंडर्ड डिविएशन. जो -2 स्टैंडर्ड डिविएशन होगा, जैसे यहां पे -2 स्टैंडर्ड डिविएशन था 50 kg, उसके जस्ट ऊपर का जो भी ऑप्शन दिया है, जैसे 53 यहां 50 के ऊपर का ऑप्शन है, वही आंसर होगा. वहीं पर 5% बच्चे मिलेंगे. What I was explaining in Hindi was कि if they ask about 5% student, answer cannot be 50 kg. Why? Because between 50 to 90, 95% are there. So if you remove 95 from 100, 5% are left. And that 5% will not be on one side. That will be 2.5 and 2.5% on both sides. So below 50, you have only 2.5%. And similarly, above 90 also there is 2.5%. So below 50, there is only 2.5%. And in the question, they're asking about 5%. Answer can also not be 47, because below 50, there is 2.5. So below 47, there will be much less number of student. Much less, hardly 1.5%. So 47 is also not the answer. But 53 can be the answer. Why? Because if you go just above below 50, just above 50, let's say you go from 50 to 53, there is a possibility that between 53 and 50, you can find 2.5% people. So now below 53, there is first 2.5% between 53 to 50, and then remaining 2.5% below 50. So finally 5% people are below 53. So in all such question where they are asking where the 5% people will lie, you have to go just above -2 standard deviation. Like in this question, -2 standard deviation was at 50. Just above -2 standard deviation is 53. So below 53 kg, you can have 5% people. This is a very interesting question, and I'm sure some of you might be confused yet. So let's do one more question on this topic. This is the exact question which came. Again, they are asking where will be 5% female. So whenever they are asking question about 5% female, always first find 95% confidence interval. And you all know the formula. It is mean plus minus 2 standard deviation. Now in this question, mean hemoglobin is given 10.6. So mean is 10.6 plus minus 2 into standard deviation. What is the standard deviation? Standard deviation is 2 plus minus 2 into 2. So 10.6 plus minus 4. If you do 10.6 minus 4, it will come 6.6. 10.6 plus 4, it will come 14.6. So 6.6 is minus 2 standard deviation. 14.6 is plus 2 standard deviation. I want all of you, my friend, to tell where will 5% female will lie. Is it 8.6, 6.9, 6.3 or 6.6? Where will 5% female will lie? Because again, if you draw the curve, again in the curve, this is 6.6 minus 2 standard deviation. This is 14.6 plus 2 standard deviation. They are asking where will 5% female will lie. Will they lie at 6.9? Will they lie at 6.3? Will they lie at 6.6? What is your answer? Please reply in the chat box. I am waiting for your reply. Okay. So do reply. Okay. Chalo. Last question. Oh, this question you have replied already. B. Dhanush is replying. Amit is replying. Swastik Kanan is replying. And all are replying B. B. So what is this B? Let's check out the B. Very simple. Dekho. Very good. First thing is, if you look 6.6, below 6.6, there is only 2.5% people. So 6.6 can never be the answer. As I said, if you go just above -2 standard deviation, you went till 6.9. So there is a chance between 6.9 and 6.6, you can find 2.5% more people. And finally, how many are below 6.9? 5%. So just above -2 standard deviation, just above 6.6, whatever is the answer, that will be the place where you will find 5% people. So 5% female will be below 6.9. And it was an interesting question, but you still got it, so it's very good. Now, let's understand the concept of Z score. And on this Z score concept, they have asked a very good question in INICT from the growth chart and Z score combined knowledge. So let me explain this Z score part to you first. What is this Z score? It's very simple thing actually. I said that, let's say there is a population of your student. There are 100 students. And out of this 100 student, they are sitting in various rows. Suppose in the center of the class, there is a girl sitting, her name is Monica. And I want to know how far is one student, Rahul, who is sitting at one corner of the class, from the center of the class, Monica. If I want to know how far is Rahul from Monica, one student from the center of the class, this is Z score. And if I want to know how far is each student from the middle student, that is standard deviation. Standard deviation is how far is each number from the middle number of the sample. But if I want to know how far is one number from middle number, not all the number from middle number, one number from middle number, that is Z score. Let me explain it more with these two examples. Z score has this formula, given value minus mean by standard deviation. So let me explain the meaning of Z score through this numerical, and it will make the concept of Z score very clear. The question is, of course, what is the formula of Z score? Z score is given value, any given value. You want to find how far is Rahul, that is the given value, from Monica, who is the mean of the class, in terms of standard deviation. How far is Rahul away from Monica in terms of standard deviation, that is Z score. Let me explain with this example. Because Z score has two uses. First use of Z score is in bone mineral density test report. And second use of Z score is in WHO growth chart. So in bone mineral density test score and WHO growth chart, we use Z score. So let's explain this first with bone mineral density test report. You are sitting in an orthopedic OPD or a general medicine OPD or a obs-gynae OPD also, and a female came to you. On her report of bone mineral density test, the report is written Z score of -3.2 Z. This is Z score. So based on this report, what is the calcium level of this lady? You have to tell. You have to decide if it is -3.2 Z, will you give 2 tablets of calcium with vitamin D sachet once a week for 2 months? Or will you just give 1 tablet of calcium? Will you be aggressive or will you be normal with this patient? Z score help us to find that. So let's do this question. Find the calcium level of this female. If mean calcium is 10, mean is 10, standard deviation is 1, Z score is -3.2, find the calcium of this female. So in this question, given value is not given. You have to find the given value. This is X. And I don't know why math always try to find the X. So you have to find the X here. What is the given value of calcium in this lady? X minus 10, because mean is 10 by 1, standard deviation is 1, is -3.2. So 1 is gone.
and it will become x will be equal to minus 3.2 plus 10, because this minus 10 will go there, it will become plus 10. So x will come 6.8. So what is the calcium level of this lady? The calcium level of this lady is 6.8. Now, what does it mean? It means that if this is the data for calcium level, average calcium of the population is 10. So these are the 100 ladies of 55 year who are coming in this graph. These are all ladies coming in this graph. Average is 10. Mean is 10. We all know minus 1 is standard deviation. Standard deviation is 9. So 10 minus 1 is 9. Minus 2 standard deviation is 8. Minus 3 standard deviation is 7. Now, how many value are between minus 3 standard deviation and plus 3 standard deviation? We already know that between minus 3 and plus 3, 99% lady are between minus 3 and plus 3. So if 99% are inside between minus 3 and plus 3 according to standard normal curve, how many are outside? 99 is inside, 100 minus 99, left is 1%. And out of that, 0.5% lady will be here, 0.5% lady will be here. And where is our female of this question? Our female has calcium level of less than 7. Her calcium level is 6.8. 6.8 is minus 3.2 standard deviation or minus 3.2 Z score away. So our lady has the least calcium out of 100 female, or I can say out of 200 female of her age, her calcium is the lower most. 0.5 means out of 100, 0.5, or out of 200, last one. So this female has 2 less calcium. She can have pathological fracture any moment. You have to be very aggressive on any patient who come in OPD with minus 3 Z score or minus 2.3 Z score or 2.3 Z score. All these female are very serious. So you will get a report with minus 3 or minus 2, it's very serious. If the report is minus 1.7 Z score, then it is means they have some moderate malnutrition or moderate problem. So this is moderate problem. And if the score is less than minus 2 or less than minus 3, then it's a serious problem. Okay. So always remember, if on any report you found minus 2, minus 3, it's serious. 1.73, it's moderate. And here, what the Z score is telling us? Z score is telling us that our female patient is 3.2 standard deviation away from average of the class. So it is telling position of one lady which is away from the average of the class by 3.2 standard deviation or 3.2 Z score. One female, how far is away from the center of the class? How far is Rahul away from Monica? And one student away from the center of the class. That is Z score. Not how far all of the female are away from 10, but how far is one lady away from middle, that is Z score. So Z score tell us how far is one number from the middle of the class or the average of the class. So this is the concept of Z score. Now, this Z score concept we also apply in WHO growth chart. I hope you know, in WHO growth chart, we take children of 6 countries, Brazil, Oman, UK, Ghana, Norway, and India. And based on observation of children from 6 countries, we draw an MGRS growth chart, multi-centric growth research center card, multi-centric growth research study based WHO card. And that's why the whole world accept the growth chart. So in the growth chart, I'm sure you must be knowing that there are this weight we write here and age we write here. Weight for age is the growth chart of Anganwadi. And up to which age children go to Anganwadi? Age is up to 6 year, children go to Anganwadi. Up to 6 year, children are going to Anganwadi. And one recent modification, they have merged Anganwadi with government school, so that the dropout is less. Previously, students go to Anganwadi, but some of them don't used to continue in the school. So now they say everyone who join Anganwadi will continue in school. They should be integrated. Anyway, so weight for age is drawn in Anganwadi. And if it is the uppermost line,
50 percentile of weight of boy we write here. Because boy weight is bigger, so we put the upper criteria for boy. Second line is third percentile of weight of girl. Because weight of girl is less, so we put lower criteria as weight of girl. And if any child is between 50 and third percentile, we call this child is following road to health. This child is normal. Now, where is this third percentile? Third percentile is at -2 standard deviation. Why -2 standard deviation has third percentile? Because remember, in the growth chart, in the normal chart, how many value is outside -2? Outside -2 is 2.5% value. And remember, we just discussed 2.5% here, 2.5% here. So can we have 2 and 0.5 children? No, no. So rather than writing 2.5 percentile, I write that at -2 there is 3 percentile of girl. So remember, -2 standard deviation is third percentile of weight of girl, and anyone who is between this 50 and -2 is the normal child. If the growth, they have asked this question in NEET already, that if the growth is between second and third line, will you call it mild malnutrition or moderate? So this between second and third, you have there is nothing like mild malnutrition. So between second and third standard deviation, you have moderate malnutrition. And if anyone is below -3, we call it severe malnutrition. Okay. So I hope you will remember it. Below -2 problem start. There is no problem if it is more between 50 percentile and third percentile. And where we have -2 Z score, we can write -2 Z score. -3 standard deviation means -3 Z score. So problem start when it is less than -2 or less than -3. Above it is normal. So now suppose, let me ask you one question. Suppose I took my girl child Prisha Lakshmi to you, and you are the pediatrician or the PSM person, and you measure my Prisha Lakshmi weight and it came here. This child, what will you call this child? Is it a obese child or is it a normal child? Obese or normal? Do reply in the chat box. What do you think about it? Now, one more extra concept you need before solving this question, which was in the AIMS exam, is one more concept which you should know is that when there is low weight for height, what do you mean by low weight for height? Low weight for height means less than -2 Z score or less than -3 Z score. This is low weight for height. So low weight for height, does it indicate acute malnutrition or chronic malnutrition or both? This is my question. Is it acute or chronic or both? Do reply. Acute or chronic or both? Which type of malnutrition is here? Because I hope you all know, if there is low height for age, low height for age is known as stunting. And if the height is less, it means in the childhood the nutrition was not good. So if the height is less, definitely this is showing chronic malnutrition. Low height for age is chronic malnutrition or familial short-heightedness. And if there is low weight for height, then what will you call it? Low weight for height, what will you call it? This is my question. If it is low weight for age, low weight for age is known as undernourished. And this low weight for age indicate both acute and or chronic malnutrition. It indicate acute and or chronic malnutrition. So my dear friend, let me explain this part to you, the last, low weight for age. Imagine me as a malnourished child. Okay, can you imagine it? I'm very thin, very malnourished. Imagine. Because when I say pregnant, you imagine very quick. Now imagine I'm a malnourished child, undernourished child. So my undernourishment can be due to two reasons. One reason कि मेरे बचपन से ही मुझे माँ ने खाना नहीं दिया है. My mother has not given me food since childhood. So it's chronic malnutrition. Second reason can be my wife is not letting me eat food for last 2 weeks.
So that is acute problem. Or I have loose motion for last 2 weeks. That's an acute problem. So my weight can be low due to acute or chronic, any one of the problem. Either my wife can cause low weight, acute problem, or my mother can cause low weight, chronic problem. So anyone can cause low weight. That's why I use the word or. Or maybe my mother and my wife are planning together to keep me malnourished. So that means acute and they are together, or any one of them. So I hope you understood it in a real example also. A child can have chronic malnutrition and weight can be low. Or a child can have diarrhea only from 2 weeks and the weight can be low. So acute or chronic, anyone can cause low weight. That is why in Anganwadi we use weight for age growth chart. Why we use weight for age in Anganwadi? Because weight for age can tell acute also, chronic also, both kind of problem will be caught in weight for age. So weight for age chart is used in Anganwadi. Now, what is low weight for height indicate? Definitely low weight for height means height is good. And if the height is good, problem is never chronic. But now since 2 weeks or to some short duration, the child is having loose motion and losing the weight. Height is good, weight is less. आप अपने बैच के सबसे पतले और सबसे लंबे बंदे या बंदी को याद करो, बहुत लंबा और बहुत पतला, उसी को कहते हैं कि सूख गया, wasted. The guy or the girl in your class who is very tall and very thin, that is the guy or boy who is wasted. So wasted means problem is acute malnutrition. Due to some breakup or some recent problem, they are not eating well. So the height is good. That means chronic problem is not there. It's acute malnutrition or wasting. And remember, when low weight for height is less than -3 standard deviation, less than -3 Z score, or mid-arm circumference is less than 11.5 centimeter, which is red in color, or there is visible wasting and edema. Visible wasting, you can see that the child is dried up, or there is pitting edema. If any of these 3 criteria is there, then we call the child as SAM, severe acute malnutrition, which is asked again and again in pediatrics. So SAM is less than -3 Z score for weight for height. Very frequently asked question. SAM is less than -3 Z score, weight for height. SAM has nothing to do for height for age or weight for age. It is only weight for height. Why we use the criteria of weight for height for SAM? Because weight for height is not dependent on age. And sometimes when you ask the age of the child, mother can give wrong age or she can forget the age. She will remember in village area. I remember some mother can tell that this was born during Diwali or during Ramjan, but which Diwali, which Ramjan they forget. So age is always, and in city, like in my certificate, the age is written 86, but my real age is 85. So they can have wrong age document. So we never use age criteria to decide severe acute malnutrition. For severe acute malnutrition, we use weight for height or mid-arm circumference, because mid-arm circumference is also not dependent on age. From 1 year till 5 years, mid-arm circumference remains same. So they can ask it in a separate question in pedia, which 2 criteria is not dependent on age. Remember, weight for height and mid-arm circumference not dependent on age. That's why they use these 2 criteria for severe acute malnutrition. So now let's go to our interesting question. The question is, you are sitting in OPD, pediatric OPD, and you got weight for height -1.73 Z, weight for age -3.2, and you also get height for age -2.8 Z. So height for age is low because -2.8 is a serious problem. Weight for height is -1.73. That means weight for height is moderate, normal or moderate. Weight for height is not the main problem. Main problem is height for age. Height for age is low. Height for age low. So if you found height for age low, under which category you will classify the patient? That's what they have asked. We all know if height for age is low, the problem is chronic malnutrition. So answer will become chronic malnutrition. Okay. So this is the type of question which can come from integration of both the thing. Let me create a good confusing question for all of you. The question is height for age
is minus 1.73 Z. Weight for height is minus 2.8 Z. And weight for age is minus 3.2 Z. This three criteria is given. Now, the question is, this child belong to which category? This child have which thing? Option A, this child has acute malnutrition. Option B, this child has severe acute malnutrition. It's a SAM child. Severe acute malnutrition. Option C, this child have chronic malnutrition. Or option D, this child has both acute and severe acute malnutrition, both A and B. What is the answer? Now reply using the same concept which we just discussed. Pause the video and try to reply it first, then move ahead. It's a very interesting one, because they have asked a similar question, they can ask it again. What is the answer? Please do reply in the chat box also. So how to answer such question? First, find what is normal. What is normal? What is normal? Height for age is normal, because whatever is not less than -2, not less than -3 is normal. So if the height for age is normal, it means chronic malnutrition is not there. Chronic is gone, because remember in the last example, because height for age was minus 2.8 Z, less than -2, so there was a chronic problem which we answered. But here it's not chronic problem. So problem is acute. So what is the answer? Acute or severe acute or both? We just discussed what is the criteria for SAM. For SAM, weight for height should be less than -3 Z, not -2.8 Z. So it's not SAM, because for SAM it has to be less than -3 Z. So it's not less than -3 Z, it is -2.8. So it is not SAM. The answer is A. It is only acute malnutrition. If it is 3.8 Z, -3.8, then answer will become D, both acute and severe acute. But here it is not less than -3 Z. So answer is just acute malnutrition. Okay, not SAM. So this was a good question. I hope you liked it. And the correct answer is given by Gaurav, Dr. Priya, Amit Sam, and Dhanush Gaude. So very good. And Som Subhadra is also correct. Very good. So you all have given the correct answer of this tough question also. Very good, very good, very intelligent. I'm very impressed with your quick reply in the chat box also. So this is Z score. Now the last concept, the second last concept I can say which we have to understand is the concept of coefficient of variance. What does coefficient variance does? It helps in comparing dispersion among data set, two or more data set, or it helps to compare quality of data set. This simple line has been asked 2 times in NEET PYQ, that what is the purpose of coefficient of variance? The purpose of coefficient of variance is it compare between two data set, that which one is of better quality. And the formula of coefficient of variance is standard deviation by mean. We can multiply it with 100 if we want to get coefficient of variance in percentage. So let me explain how it compare two quality data set or two data set with a very simple example. Suppose you are sitting in my OPD and two patients came to you, and you ask from both the patient, when does it wake up? Kab ut jata hai? My OPD means sex and marriage counseling OPD, because I am a trained sexologist, of course, from AIIMS New Delhi. When I was doing my post graduation from 2013 May to 2017 from AIIMS New Delhi, 17 because I failed also 2-3 times. So at that time they used to place us in the sex and marriage counseling OPD for 3 months. So I am a trained sexologist. You can ask any of your question on my number also. You can simply say that my friend has this problem. I will understand who is the friend and I will answer it. Okay. So you have two patient and आप क्या पूछ रहे हो, कब उठ जाता है? You are asking when does it wake up? It means you are asking about morning erection. And this is the first question for all the cases of erectile dysfunction, because if morning erection is absent, बत्ती बुझ गई है ना, the problem can be pathological or severe depression can be there if morning erection absent. If morning erection is present, problem is just psychological. We can help with counseling and some minor medicines also. So there are two patients. One patient said, सर कभी 4 बजे, कभी 5 बजे, कभी 6 बजे, जब भी पड़ोसी का मुर्गा जगता है मेरा भी जग जाता है. Whenever the neighbor cock wake up, my also wake up, है ना, 4, 5, 6 a.m. And second patient said कि sir sometime 2 a.m, sometime 6 a.m, sometime 10 a.m. So this is two patient data. Now what is the formula of coefficient of variance? It is standard deviation by mean. So in the first patient, what is the mean? This will help us to revise the concept also. Mean is 5. Why 5 is mean? Because 4, 5, 6 are equally away at 1, 1, 1 number, and in equally away data, symmetrical distribution, middle number is the mean. So mean is 5. Now how far is each number away from 5? 4 is also away by 1, 6 is also away by 1. So standard deviation is 1. So it is standard deviation by mean 1 by 5 or 0.2. So coefficient of variance is 0.2 here. Now if you look at the second patient, again in the second patient, what is the coefficient of variance? It is standard deviation by mean. So what is the mean in the second patient? 6 is the middle number. So mean is the 6. And how far is each number from middle number? Each number is away by 4. So standard deviation is 4. So 4 by 6 means 0.66 is the standard deviation, is the coefficient of variance in second number. So which data is of better quality, patient 1 or patient 2? Remember, if the dispersion is more, data is of poor quality. So if the coefficient of variance less, coefficient of variance lesser, lesser coefficient of variance, better quality data. तो एक बात आप अच्छे से जिंदगी में याद रखना कि हम सभी को चाहिए जिंदगी में बड़ी चीज, लेकिन दो चीज जो सी से होती है वो छोटी होनी चाहिए. जितनी छोटी है उतनी अच्छी है. कौन है वो दो चीज जो सी से होती है और छोटी होनी चाहिए? We want big thing in life, but two things which start with C should be smaller. The smaller, the better. What are those two things with C? One is coefficient of variance. Second is confidence interval. Coefficient of variance and confidence interval, both lesser range of confidence interval or lesser coefficient of variance means better quality data. So these two things with C should be small. Confidence interval, coefficient of variance. Okay. So what does coefficient of variance do? It compare quality of two data set or dispersion of two data set, and less dispersion, less coefficient of variance, less confidence interval means better quality data. Okay. So this is all the concept from coefficient of variance. Remember, lesser the confidence interval or coefficient of variance, better the quality of data. Okay. So this is the question, and let's revise the formula which we discussed. Remember, there are total 10 formula from which numerical can come. So before going to exam, if you revise this formula, you can do the question. So variance is standard deviation square. This is first formula. Second formula is standard error is standard deviation by under root of sample size. Third formula is coefficient of variance is standard deviation by mean. Fourth formula is Z score is given value minus mean by standard deviation. Fifth formula is 68% confidence interval is mean plus minus 1 standard deviation. 95% confidence interval is mean plus minus 2 standard deviation. 95% confidence interval for population if they give, then it is mean plus minus 2 standard deviation by under root n. And there is one more formula which I want to tell, that mode is 3 median minus 2 mean. This formula has not been asked in last 10 years, but it can come. If they have a skewed curve, in a skewed curve, mode is 3 median minus 2 mean. How will you remember? Again, just remember the original concept. What was the original concept? The original concept was कि median बीच का है. Median always remain in the center. है ना? Just like me, median is always in the center. है ना? Median. So median is again here also in the center. Mode is 3 median minus 2 mean. 3 median minus 2 mean. You can remember it. Not tough. Okay. So then one last formula is, if you want to know the sample size of a cross-sectional study, it is Z square PQ by E square. But Z means 1.96. So if you do 1.96 square, it will come 4. So the formula is 4 PQ by E square. What is E? E is effect size or precision. And why we have not written E with P? Because if you write E with P, PP will cancel out. So how they can ask this question? They can ask this question. They will give prevalence of disease. Suppose they give prevalence of anemia. Anemia prevalence is 50% in a population. Okay. So if P become 50%, what is Q? Q is 100 minus 50%, and 100 minus 50 is also 50%. And then they gave the sample size. Suppose they gave the effect size or precision. Precision size is plus minus 5%. So you can have the fluctuation of anemia from 45 to 55%, plus minus 5% from 50. Find the sample size. So to find the sample size, what will you do? Very simple. To find the sample size, you will use 4 PQ by E square or precision square. What is P? P is 50. What is Q? Q is also 50. And what is precision? 5. 5 square means 5 into 5. So all the 5 and 5 will cancel. Sample size will come 400. Remember this point. If you are doing a new study, for a new study, always if you don't know the precision and you don't know the sample size, you don't know the prevalence. So for a new study, we take prevalence as 50% and precision as 5%. So if you are doing a new study also, sample size will always be 400. Remember, prevalence for a new study is taken as 50% and precision, if not given, you will take it as 5%. So for a new study also, sample size will be 400. So these are the formulas. And last formula, and last but not the least, identify the formula of standard deviation. As I said, standard deviation has 3 characters. When we write a standard deviation, first is we write under root to remove the square sign. We add all the mean minus number. We do square to remove minus sign. And under root to remove square sign divided by n minus 1 degree of freedom. This we do when sample size is less than 30 or equal to 30. If it is more than 30, then the formula will be here. We will not put n minus 1, we will only put n. So this is the formula for standard deviation. They can ask to identify. You have read the whole story, so you can identify it. Chalo, now, there is not just one coefficient of variance. There is also coefficient of regression, coefficient of correlation, coefficient of determination. And they can ask, if one variable is given, how can you find the other variable? So my dear friend, to answer this question, let's understand the concept of correlation and regression. What is this correlation? Correlation means direction of association between two variables. For example, suppose I am talking about hours, ghanta padhai ka or marks, hour of study and marks. We all know if the hour of study will increase, marks will increase. So this is which type of correlation? Positive correlation. And if you are talking about temperature and size of cloth, you have generally felt that when the temperature increases, size of cloth decreases. So there is a negative correlation, and it's a very simple thing, correlation. Suppose you are studying with your room partner, which can be male, female, transgender, depending on your priority, available opportunities, and your budget. So if your marks is increasing and your room partner marks is also increasing, both are increasing together, positive correlation. Your marks increasing, your room partner marks decreasing, negative correlation. And your marks increasing, your room partner is same, no correlation. So correlation is just the direction. And if your marks is increasing and your room partner marks is decreasing, is your room partner marks decreasing because your is increasing? No, no. So these are just two things which are happening in opposite direction. But it doesn't mean one is causing the other. That's why Hill said this line, that correlation does not imply causation. If two things are happening together, it doesn't mean one is causing the other. Correlation does not imply causation. It only tells the direction, that whether they will be in the same direction or opposite direction. Now, this is correlation, but correlation only gives us direction. One more thing is coefficient of correlation, which tell us how strongly two things are correlated. So in the coefficient of correlation, we use the value R. And R can only be between -1 to +1, because it is just telling us direction. If they are in opposite direction, -1. If they are same direction, +1. And if the value of R is between 0.1 to 0.3, we call the correlation as weak. 0.4 to 0.7, we call it moderate. 0.8 to 1, we call it strong. Sometime in exam, they give the value of R as +1.2, -2.4. If they give you anything more than +1 or less than -1, it means it's a wrong data. Because R can never be less than -1, can never be more than +1. So what does coefficient of correlation tell? It tells strength of association. It tells how strongly two things are associated. Okay. So for example, from this topic, they can ask this question. They can give you two plot. Plot A, plot B. In A, the dots are far apart. In B, the dots are closer to each other. And they will ask which one is strongly correlated. So remember, if you draw an imaginary central line and dots are very far away, it means weak correlation somewhere like +0.5. And if the dots are closer to the imaginary central line, correlation will be stronger somewhere like +0.7. सीधी सी बात है, हमें डेटा फैला हुआ नहीं चाहिए, to the point चाहिए. We don't like dispersed data, we like to the point data. So if the dots are to the point in the center, we call stronger correlation. So a stronger correlation is in B because dots are less scattered. And if the dots are exactly on the central line, then correlation will be perfect 1. So here, of course, this B has a stronger correlation coefficient, stronger R, stronger correlation coefficient. So if the dots are closer to the imaginary central line, correlation coefficient will be bigger. Okay. Then in one of the INCT or NEET exam, they created this very good question actually. They gave you a graph with multiple color dots. This is study 1. This is study 2. This is again study, let's say 3. 4 different color dots they have given. And then study 4. And they said, if all 4 study have R equal to 0.6, what is the final R? Final correlation coefficient. So because all 4 studies are at the same distance from imaginary central line, so R of the final study will also be 0.6 because all 4 study have same dispersion. So final study including all the 4 will also have the same correlation coefficient of 0.6. So this correlation coefficient tell the strength. But if you do the square of correlation coefficient, it is coefficient of determination which tell percentage variation. Percentage variation in one variable on changing other variable. Let me explain these concepts with a story, with an example. Suppose just after listening to the class, you went back to your room, and your room you found that there is a fog. In this summer day, there is a fog in your room. Your room partner is sitting there with laptop on, something he is watching on the laptop screen, and with one joint on his mouth. And the fog is due to that joint. And you have seen that your friend earlier used to smoke 1 joint per day. Now your friend is smoking 6 to 7 joint per day. From morning till evening, dhaka dhak, phaka phak, phaka phak. So due to smoking 6-7 joint per day, marks will increase or decrease? You can try it myself. You can try it yourself, my dear friend. Marks will decrease if you smoke 6-7 joint per day because joint will relax you too much. It causes amotivational syndrome. It never causes memory loss, but it can make you relax, and so you will not feel like studying, and therefore marks will decrease. So you explain it to your friend, look, my dear friend, this marks and joint has negative correlation, direction is negative, and they have a strong negative correlation of -0.8. And if you do the square of correlation coefficient, it will come -0.8 square will come 0.64 or 64%. So this 64% is coefficient of determination, which means you can tell you to your room partner that, my dear friend, if you decrease the joint per day, then your marks can increase by 64%. This is what coefficient of determination tell us, that if one variable you change, how much percentage fluctuation will come in the other variable. Like here, if you decrease the joint, marks can increase by 64%. So these are the 3 things.
What do you think? Your room partner will understand with this logic? No, he or she will take one more puff, put a cloud on your face, and will say, dear, I am flying somewhere here and you are on the ground. Take one puff, come to my level, then we will talk. And they will not understand like this. So, and they can ask, hey, forget this percentage bullshit. Just tell me one thing, that if I decrease my joint from 6 to 1, will I be able to get 50% marks in exam or not? Will I be able to get 5 out of 10 or not? Will I be able to pass or not? So now your room partner is not asking percentage variation. Now your room partner is asking exact variation. And if you want to tell the exact variation in marks on changing number of joint, you need a mathematical formula here, which is in the regression. So only regression can tell the exact variation. Why it can tell the exact variation? Because it has a mathematical formula, y is equal to bx plus c. This is the mathematical formula for simple linear regression. So for linear regression, we can use this formula, y is equal to bx plus c. And if x is given, we can find the y here. Okay. If you want, I can do it for you. And to make you understood this concept, we can further understand this part. See this thing. The thing is here, this is the joint which is going down. And this is the marks on the y-axis. This is the number of joint which is decreasing the marks. So suppose your friend is asking that right now I am smoking 6 joint per day. If I decrease x1 to x2, 1 joint per day, will I be able to get pass or not? So here, this angle which is formed between y and x, this angle is known as coefficient of regression. And this angle is minus 45 degree. Minus 45 degree means 135 degree. And tan 135 degree means minus 1. If the plot is something like this, going in the forward direction, then the angle is 45 degree and tan 45 degree is 1. So if they say linear association in positive direction, then the regression coefficient is 1. But if it is in negative direction, regression coefficient is minus 1. And the formula we all know is, what is the formula? Formula is y is equal to bx plus c. What is c? C is this constant. Suppose c or constant is 7. So right now, the value of b is minus 1. Joint your friend is smoking is 6. And c is 7. It will come minus 6 into 7, 1. Right now, your friend is getting 1 marks out of 10 or just 10% marks. What you are telling to your friend? That decrease this x from 6 to 1. So now the second time when he will decrease the joint, what is the marks which he is getting here? X2 is just 1. You are asking him to decrease from 6 to 1 plus 7. How much will come out? Minus 1 plus 7, 6. So if he decrease the number of joint, from 6 to 1, the marks can increase from 1 out of 10 to 6 out of 10, and he or she will pass the exam. So you can tell that according to coefficient of regression, if you decrease from 6 to 1 joint, your marks will increase from 1 to 6, and you can pass the exam. And here your room partner may accept, because you are not asking him or her to quit. You're just wanting him to decrease for 6 months. And of course, after exam, you can again start smoking. It's not that after exam, weed will be gone from the world. And so just control yourself for some time, and then you will find that the result will be good. I have seen many of my friends at AIIMS New Delhi who smoked for 3.5 years, but for 6 months before exam, they quit. And then they got all India 200, 300 rank also, and even 50 rank also. So it doesn't affect the memory, but it affects the motivation. So please quit it for some time before exam, at least, or decrease it at least. And it's good for you. Chalo. So this is the question which can come from this topic. The question, let me ask you a very interesting question from this topic. The question which they asked from this topic was, one time they have asked this question. I was totally happily perplexed with this question. The question was, they create a snake-like thing. ऐसा एक सपोला बना दिया. And they ask, which equation is correct? Which equation is correct? Is the correct equation is option A,
y is equal to x plus c, or option B, y is equal to minus x plus c, or option C, 4y is equal to 2x plus c, or option D, minus 4y is equal to minus 2x plus c. What is correct? So my dear friend, this plot is there, but if you draw an imaginary central line, which is at minimum distance from all the dots, the imaginary central line will go straight. Straight means this angle is 45 degree and tan 45 degree is equal to 1. So which equation is correct? Can you tell? A, B, C, D in the option? Which option is correct? Please tell. We all know the formula is y is equal to bx plus c. And this tan 45 degree is the b. So in place of b, you can put 1. If you put 1 in place of b, the formula 1 comes 1x plus c, or simply x plus c. So if the line is going in straight direction, it is x plus c. If the line is going in negative direction, then equation 2 will be correct. Y is minus x plus c. So negative direction minus x plus c, positive direction like this, x plus c. So this was an interesting question. I hope you will answer it and you understood it. If not, if anything which I am explaining is not clear, or you want me to explain any concept which I read till now, please ask it and I will explain it again. Let's do this one more question. If one variable is given, how can you find other variable? Can coefficient of variance help us? No, because it compare the quality of data set, so it can never help. Can regression help us? Yes, regression will help us. If one is given, other can be found only by regression, because only regression has the mathematical formula bx plus c. So if x is given, y can be found only in regression. Correlation, coefficient correlation tell strength of association, how strongly two things are correlated. And coefficient of determination give percentage variation. So this one question can help us in revising all the coefficient. Determination tell percentage variation, correlation tell strength of association, and variance compare quality of two data set or compare dispersion of two data set. So these are the 4 coefficient. Do revise it before exam, and it's, I think if you read it like a story with such example, you will never forget. Okay, so we have finished all the mathematical part of biostat, but in the biostat there is also one very important concept, how to represent the data. Because let's say you collected the data that 500 deaths occurred last year due to diarrhea in your state or in my state. My state is United States of Bihar, and I am from USB. So in United States of Bihar, I collected the data that this year 500 deaths due to diarrhea occurred. Next year 800 deaths due to diarrhea occurred. And all this data which I am collecting, if I am unable to express this to politician, then of course I will not get fund to correct the situation. And you know the current chief minister of Bihar and the most educated Samrat Chaudhary and all. So for such politician, if you want to explain the data, you need to present it with various diagram and chart. So without this data representation method, we can never get the fund and we can never correct the situation. So let's understand how we represent data. First is about quantitative data. Quantitative data is something which is continuous, which has no gap in between, and like weight, BP, height and all. So suppose I am writing number of cigarette you are smoking per day with age. Usually no one started smoking before 10 years of age. है क्या कोई शिकारी class में? है ना? I have found only one person who started smoking before 10 years of age. That is my best friend Ajay Verma girlfriend Tejashwini. Tej Ashwani, my faster version. है ना? So she said कि when she was young, her grandfather used to smoke bidi. She used to sit below the bed or khatia, and whatever bidi, you know, na? Whatever bidi his grandfather used to leave, she used to take and smoke the remaining one. So usually no one started smoking before 10 years. Then some people joined, some more joined, and some idiot like me started smoking after around 30 years. And then by the time we reach 40, we start realizing that smoking is not giving us any high and decreasing our vital capacity. So we start decreasing it. So this type of data representation is histogram. Remember, histogram has no real gap. There is one gap between 0 to 10, but this gap is also saying that the smoking number was 0 here. So gap also represents some data. In histogram, there is no real gap. Now, if you join the midpoint of bar of histogram, suppose here these are histogram and you join the midpoint like this, it will be a sharp turn, and we call this blue line as frequency polygon. But suppose the histogram is like this, where the bar are very close to each other, very close, very close, very close. So if they are very close to each other, all the bars, and you join their midpoint, then their midpoint will be smooth, and we call it frequency curve, because curve is always smooth. Look at my curve, smooth na? So curve is smooth, polygon is sharp. Okay, but both polygon and curve are formed by joining midpoint of bar of histogram. Okay, so they are both formed by joining midpoint, but curve will always be smooth. Like suppose I am writing GDP spend on health in January, February, March, April. In May there was election, so till election they spend some money on health, then they decrease it. So such data can be represented by curve. If they are close to each other, curve, far apart, and join the midpoint, polygon. Now the third is OGV. It's the fourth. Histogram, curve, polygon, and now we have OGV. OGV is cumulative frequency curve. What does it mean? Cumulative means adding. So what we are doing here is we are adding this histogram with 1. I was putting on 2, 2 over 3, and 1 also over 2, 1 also over 3. So histogram become cumulative histogram. And now if you join the midpoint of this cumulative histogram, it will always go above, always go above. This is OGV. OGV always go above. And I was drawing it in one of the class. A student said, "Sir, what are you doing? Are you doing OGV or ORGI? What does it mean? How does it help?" I said, it really helps. Suppose I collected the data in 2021, 500 cases of diarrhea occur, and 21-22, 800 cases of diarrhea occur, and then again 22-23, again the cases of diarrhea decrease to 500. So if this data I presented to the health minister of Bihar or CM of Bihar, Samrat Chaudhary, 500, 800, then again 500, they will not give fund to me. They will say that anyway, how the case has decreased to 500, so let's wait for 2-3 years more, it will further decrease. So what I can do is I can present all the bar one above another, and then I can draw OGV, put a star, and write and present key. See, the cases of diarrhea is going like this. So if you do not give me fund, it will further increase, and I will put a star and write OGV below it. Even doctors don't know properly what is OGV. How come politician will know? And I might get fund if I present my data in this form, OGV. So this OGV you all have seen in Corona Worldometer time. Corona Worldometer was always increasing. Why? Because they were adding all the cases which occur in the past. Even if they recovered, they were adding it. So OGV always go above, it never come down. That's the property. Okay. So this is OGV, always going up. Then in the line diagram, we represent trend of event. Remember, if I am showing line diagram will always represent trend of event. For example, in my previous photo, I am showing you trend of secular trend. Secular trend means constant increase or decrease in the number of cases over a prolonged period of time. If the cases are constantly increasing, constantly decreasing, then we call it secular trend. Example of secular trend is all the cardiovascular disease. Let me show you the diagram. See, the cases of cardiovascular disease, hypertension and diabetes, they are increasing in the world from 1950 till now. So they are constantly increasing. That's why it is following a secular trend. And line diagram represent trend of event. So this secular trend has been asked again and again, and represent line diagram represent trend of event. Then we have the box and whisker plot, which I just discussed in a skewed curve part. What is the use of box and whisker plot? Box and whisker plot identify outliers, the extreme value. Then the next plot is a scatter plot, Chitraya Hua plot. This scatter plot is used to represent correlation, the direction. And what is correlation? Correlation is the direction of association between two variables. We just read about it. Then the eighth and last method is stem and leaf plot, which can help us to tell the exact distribution of data. So what is stem and leaf plot? See, if you suppose felt the pain of the people who are cleaning our toilet and cleaning our hospital, and you thought, let's help them by measuring their BP. And you measure BP of some female, some male who are doing the cleaning work. So if anyone BP is 120, out of 120, To arrange it in a stem and leaf plot, last number 0 become the leaf and remaining number 12 you can arrange as a stem. Again 124. So 4 last number become leaf and 12 become stem. Likewise, you will arrange all the number and only image based question can come from here. If they gave image like this, half of it or full of it, it is stem and leaf plot. And it is telling us exact distribution. If you look at stem and leaf plot, you can say that only 2 male who are 152 to 159, they need the antihypertensive medicine. Rest can be corrected by lifestyle modification and all. So exact distribution we can get by stem and leaf plot. Image based question can come from it. Okay. So these are the 8 methods of data representation. I know what you are saying कि sir ये क्या बवासीर बना दिया है? What a pile you have made, how it is useful. So let me explain how it is useful to you. Suppose for the same data, I am drawing a histogram. So to draw the histogram, I can say it's 120 to 140, 2 male and 2 female. 2 male, 2 female. Only 2 male, 2 female are between 120 to 140 if you see. Then again between 140 to 160, there is 5 male and 5 female. 5 male, 5 female. So if you draw, this is a histogram. If you draw it as a histogram, in a histogram it looks like male and female has equal amount of hypertension. But if you draw the stem and leaf plot, then it comes that 152, 159, 2 BP are in male. So only 2 male need medicine, none of the female need actual medicine. They can be controlled by lifestyle modification. So if you want to know exact distribution, then a stem and leaf plot is useful because histogram do not tell exact distribution. And now you can say, sir, still we could have seen it here, 152, 159 is written. Why to draw this plot? Of course, you can see it here. But suppose the data is of 100 people, then seeing them separately will not be so easy. So you can give the command to computer and computer will arrange all the 100 people data in a stem and leaf plot, and then you will exactly know how many of them need medicine. So it can be useful if the data is big. Of course, when the data is small, it doesn't look so useful. But I cannot take this big data क्योंकि उतनों के पत्ते बिछाने में मेरे पत्ते बिछ जाते. Because to arrange leaf of 100 people, my leaf would have been arranged. So I took some small data to explain how it tell exact distribution. So remember the 8 method which we discussed. This is stem and leaf plot, histogram. If you join the midpoint and it is like this, it is frequency polygon. If it is smooth, frequency curve. It is only going in the up, it is Ogive. If it is a straight line like this, it's a secular trend line diagram, and line diagram represent trend of event. If it is dot dot dots, it is a scatter plot, and scatter plot represent correlation. And if it is a box and whisker plot will represent outlier. So these are total 8 methods. We can revise it together in one diagram. Histogram, frequency polygon, frequency curve, Ogive, line diagram, scatter plot, box and whisker, and stem and leaf plot. These are 8 methods of quantitative data representation. Now let's talk about qualitative data representation. In qualitative data, suppose I am talking about percentage of corona case in UP, Bihar and Tamil Nadu, UP, Delhi and Tamil Nadu, and of course UP had very less case because coronavirus is very much scared of our local Van Diesel. So very less case in UP, then Delhi, Tamil Nadu, some cases. So this is percentage of corona case, simple bar diagram. But if you are representing cases with death, then it is one above another. We call it as component bar diagram. And actually this happened that during COVID, when UP government said very less death, then someone asked from UP health minister, ki, sir, there are so many body floating in your river. How come you are saying less death? They said, no, these body are not our. People from Delhi, Jaipur, they are throwing their body in our river. And they just came for floating, they went too far. So this is component one above another. And if you put one thing beside other, then this is cases recovered, it become multiple bar chart. So if you have one above another component, if you have one beside another, this is multiple bar chart. Let's do a very good question on this topic. The question is that this plot, which is not given here, so let me draw the plot. Suppose I am drawing a plot when I am writing viral load of JE and I am drawing it like this: 1, 2, 3, 4, then 1, 2, 3. Which diagram is this? And I'm writing it with some years, let's say. Suppose 2016, 17, 18, 19, 20, 21, 22, 23, 24. Which diagram is this? Is this histogram, bar diagram, component bar, multiple bar? Of course, it cannot be component bar because component one above another. It's not bar because in bar, after each bar, there is a gap. Usually, students get confused in multiple and histogram. But remember, in a multiple bar diagram, one thing is sure, it always starts with a gap. And then there are real gap between equal number of bar. Like every 2 bar, there is a gap. So this is not a component bar diagram. It's actually a histogram. In the histogram, we are showing that in between 2020 to 21, due to COVID lockdown, the reported case of JE was less, so the viral load of JE was coming 0. It is not a real gap. It is showing you some data. And there are 4 bar, then 3 bar. It's not after equal number there is gap. And it is not starting with a gap. So it cannot be multiple bar. It is a histogram. I hope you will identify it. Now the second method of qualitative data representation is pie chart. Just like pie is circular, so we have drawn circular diagram, and pie chart can be used to represent a balanced diet to layman. Okay, but here I have shown you something else, not just the balanced diet. I am showing you that if suppose in your family there is some case of uncontrolled hypertension, diabetes, so you can, or lipoma, you can always say that if you take 2/3 of your food as uncooked direct plant product like sprouts, ankurit chana, or salad, fruit, nuts, 2/3 is uncooked, 1/3 is cooked, then your intestine will be feel much lighter, roughage will be high, calorie will be less, and you can recover from those things. So this is one diet being proven again and again, that if you change it, the diet only, your BP, sugar, and lipomas and other thing can always revert, and you can improve yourself. Now you will say कि मोटे जब इतना ज्ञान है तो खुद पे क्यों नहीं apply करता? Fatty, when you have so much knowledge, why you don't apply? I'm applying it, but then I get discontinued in between. So probably I will, in next 6 months, I will look much better. So this is pie chart, circular, which can use to tell us the balanced diet. This is a spot map. What is the role of a spot map? It identifies the source of outbreak, that from where the outbreak is starting. Like this is the first spot map drawn by John Snow for cholera epidemic in London, in which all the death was occurring in the main area, central area, which is supplied by a different water company. This water company take the water from Thames River after it passes through London. So it has all the fecal matter of London in it, and it is supplying the central part where death was occurring. And in the remaining part of London, the water supply is from that part of Thames River, which water is taken before it crosses London. So it has less water contamination, and therefore the less death was there in the peripheral area. So when John Snow presented this diagram to the management, they were desperate and they removed the handle of the handbar, but they did not believe on him. And they thought कि पगला गया है John Snow. John Snow has gone crazy. How can food and water can kill us? Because at that time in England, people used to believe that only God when angry or miasma, foul air can kill us. So people did not believe it. But when they removed the handle of the handbar, death decreased. And then the people said कि John Snow was सही कहत रहलस, है ना, कि John Snow was telling the correct thing, because death decreased after removing the handle of the bar or handle of the hand pump. So do remember, who is the father of public health? No, it's not John Snow, it's cholera. Because due to cholera, we are reading public health. So cholera is the father of public health, and John Snow is the father of epidemiology and modern epidemiology. He was also the father of anesthesia and first calibrated anesthesia. So very talented man. That's why they take him in Game of Thrones. And winter is coming. And in one episode of Game of Thrones, if you remember, a girl said to Jon Snow, you know nothing. And he showed the full talent there. I just watched some part of Game of Thrones, not the full thing. So that was the spot map, help us to identify source of outbreak. The fourth is a pictogram. It's the simplest method to represent data. So suppose I am drawing a doctor, hey, all the time. This is the doctor. And this is, does it look like a doctor? Does it look? No? Hey, it has finger also, see? 1, 2, 3, 4, 5, like this, no? Doesn't look like a doctor? Okay. It has a stethoscope also. Now it look like a doctor? It has a plus sign also. Now it looks like a doctor. So I'm representing that the doctor, one doctor is at 1,000 population according to WHO. But one doctor is at 3,700 Indian. So this is the pictogram, and this is the fake data by the fake government of India, because they include physiotherapy, Ayushman doctors, Ayushman. If you write Ayush, they ask in Ayush, what does S stand for? S kya hai? S is for Siddha. Siddha is the ancient naturopathy of Tamil Nadu. AY is for Ayurveda, U is for Unani, H for is for homeopathy. So in the doctor, government of India include all the doctor, then they say we have a lot of doctor. But if you look at allopathic doctor, we still have a lot of crisis, especially in the rural areas. And if you want to earn respect and money both in your life, just go a bit out from city. You will get a lot of respect, a lot of money also, and take some risk and earn the money. Don't think that the competition is high. You increase your line and competition will become less. And just focus on your growth and you can always flourish. So anyway, if they ask a question like this, which is used for continuous data? Continuous means quantitative data which is used. So we just read that box and whisker was one of the 8 things in quantitative data. But it's so difficult to remember the classification because there is 5 things in qualitative. What are the 5 things? Pie chart, bar diagram, spot map, pictogram, and last thing is fishbone diagram, which recently came in one of the IMNCI exam question. Fishbone is also same as Ishikawa diagram. Let me explain. This is one of the best method to represent health system of India. Why the health system is functioning well or not well, if you want to understand, you can draw, let me draw a Ishikawa diagram separately. Yes. Suppose you want to know the reason of failure of health system, so you can draw a fish. I hope it looks like a fish. This is the fin. These are the various bones. And if you want to know the health system of India performance, why it's good or not good, the first reason is, of course, GDP on health, which WHO asks. This is a PYQ being asked also. WHO says we should give 5%. And how much India government is giving? 1.05%. So first thing is, and this 1.05% is not about BJP government, whether it's BJP or Congress, from 1990 till this time 2026, the money on health is same. So none of the central government is giving money on health, and you all know no money, no honey. And so the poor performance is because of one of this reason. Second reason is that government of India is giving only contractual job to doctor, and they need permanent job nowadays to shift to rural areas. So very few state government are giving permanent job, and under contractual job they are not ready to join. So 80% of the PG seats in CHCs are vacant without any doctor there. And second thing is, we say we have lots of sub-center PSC criteria, we say, but actually we have just half to 1/3 Arogya Mandir, Ayushman Arogya Mandir, because there is no more sub-center and PSC. It's all turned into Ayushman Arogya Mandir, which is very less in India, and CHC is also just half than what we need as per the population norm. So due to and low salary is also one of the reason why people join less government hospital. So there is lots of reason for that, and this is best represented by Ishikawa or fishbone diagram. So how will you remember for quantitative and qualitative how to separate? So to separate it, during my MBBS time, I used to remember it with this mnemonic that going to bar, okay, eating pie or fishbone. Does anybody eat pie or fishbone in bar? No. Or drawing picture or map in bar. These are the work which only quality people can do, okay, or quality crack people can do. These are quality work or qualitative data representation technique. So this mnemonic can help you to remember that in the qualitative data representation, there is pictogram, spot map, fishbone, pie chart, and bar diagram. Okay, so these are the 6, 1, 2, 3, 4, 5 things under qualitative. Rest all are under continuous or quantitative. So in this way, you can represent all the data representation methods separately also. Of course, I hope it was not tough. Now, let's understand the sampling technique. Sampling technique can be random or non-random. Random means everyone has equal chance of selection. Non-random means you can select anyone according to your wish. So when we talk about random sampling, first is simple random sampling, which is done by lottery method. This is best for homogeneous population. Suppose I want to know how much marks you are getting. So rather than knowing marks of each one of you, I can randomly ask, take your list from the class monitor, and I can make chit of your name, and I can ask to take any 10 people chit, and you can ask their marks. Because in terms of marks, it doesn't matter whether you are boy or girl, you all are homogeneous. So I can use the lottery method, or I can take your name and put it in the SPSS software, and I can give the command to computer, give me some 100 name. So it can randomly create some 10 name or 100 name. So this is simple random, very simple thing. But the main question nowadays coming from stratified random sampling. This is the area of PYQ. Remember, in stratified random sampling, what is happening? The population must have to be heterogeneous. Heterogeneous means the one population which is different from each other. So remember what we do in stratified random sampling. Researcher divide population based on anything. Whenever researcher divide population based on their diet, based on their religion, based on their origin, based on their sex, if you divide people and then choose equally from all 4 group or 5 group, then choose equally from different subgroup, this is known as stratified random sampling. Let me explain by a very simple example. Suppose I want to take 10 people for a party after the class. So if I did lottery method will be homogeneous simple random sampling, and I can choose 10 out of 100. But the problem in lottery method is I can get 8 boys out of 10 or 9 girls out of 10. But what I really want is that in that party, there should be 5 boy, 5 girl. Why? Because, I am happily married, settled type of person, but I want more love and more sex among you people. So if I choose 5 boy, 5 girl, they have good time to do setting with each other. Na? They will do some couple dance and more love will be there, which I truly wish. So I divide you between boy and girl, and then I choose 5 from boy, 5 from girl. So I created the layer. Layer is strata. When I create the strata and layer and then choose, it is stratified. So in any question, if the researcher divide them based on religion, diet, sex, like I am dividing you based on sex, it is stratified. Okay. So this is most common area of question nowadays, stratified random sampling. What is systematic random sampling? Very simple thing. Suppose there are 100 students in the class, and out of 100 student sample or population, 100 student population, I want to choose only 10. Out of 100 student population, I want to choose 10 student sample. So if you divide 100 by 10, it will come 10. I will ask you to give me any random number between 1 to 10. Suppose the random number you gave was participant. Every nth or every 5th participant I will be selected. 1, 2, 3, 4, 5. 5th will be selected. Then 6, 7, 8, 9, 10. Then again 1, 2, 3, 4, 5. So I am choosing every 5th. How come this 5th number came? It came randomly. And I am following a system here of choosing every 5th. So this is systematic random sampling. Okay. Now the 4th type of sampling is cluster random sampling. Suppose I choose the whole front bench 5 people or whole back bench 5 people. That is cluster random. Because cluster random means you are choosing the people in the cluster. For example, WHO immunization study we do in different, if you want to know immunization rate is more in Bihar or more in Uganda, what you will do is you will choose 7 children from 30 villages. 7 children between 12 to 23 months from 30 villages. So all these 7 children are living in the same village. They are cluster, and we are choosing 30 cluster, different cluster. So 7 children, 30 village, total sample size will be 210. And out of 210, if I found 100 children immunized out of 210 in Uganda and 150 children out of 210 immunized in Bihar, then of course immunization rate will be low in
Uganda. And every time I ask this question, the student point their finger towards me and say to me, Uganda. I don't know why. So definitely this is the way to compare immunization, not just in Bihar and Uganda, but any two state, any two country. If you want to compare, you will follow the same strategy. You will choose 7 children from 30 different cluster. So this is cluster random sampling. And in cluster random sampling, we will go and choose. Suppose I came to your medical college and divided you based on a student from Bihar, a student from UP, student from Tamil Nadu, student from Telangana. That is stratified because I am dividing you. But if I want to do a survey on medical student, I went to Bihar and did survey on 100 students there. I went to Telangana, did survey on 100 there. That is cluster random. So when I am going to different area and doing study cluster, but if I am dividing you, after dividing, selecting, that is stratified random. So I hope you will remember the difference. Now, most of the time the answer is stratified only. What is multi-stage random sampling? We call it multiple cluster sampling. This is done in National Family Health Survey. Let me explain this point to you with a very good example. Suppose I want to do a survey that in Delhi, how many students in 11th, 12th class are smoking ganja, marijuana. So draw any amoeba, it will become Delhi. And I took in the Delhi, I choose 4 area. From each area, I choose 3 colony. From each colony, I choose 2 school. From each school, I choose 40 students, 20 of class 11, 20 of class 12. So how much sample size I have interviewed? I interviewed sample size of 40 into 2 into 3 into 4. It will come 960. So I will interview 960 student and I will say this is in this 960 student, suppose 20% is children of 11, 12th class in Delhi are found to smoking marijuana. I will say in the whole Delhi, 20% of 11, 12th class student are smoking marijuana. Is it correct to say? Or is it wrong to say like this? This is the only way to say. I cannot interview all the children of Delhi. If I have to interview so many children, I need to smoke myself. Not possible in my life. So I will choose some part and then I will do my survey here. Not only in India, in US, UK, every survey done in this way only. This is known as multi-stage sampling. Now you can say, sir, why you draw the map of Delhi? Because in exam also they will ask question like this. They will give you a map and then from the map they will choose a small. That is multi-stage sampling. Okay. And why Delhi? Because sometimes if I try to do Gujarat and all and I draw something wrong, people get emotional here. But with Delhi, no one get emotional. So I choose Delhi there and do remember with map small taken, that is multi-stage. Because everyone is a cluster. So we can say multi-stage as multiple cluster sampling. So this is multi-stage sampling. And as I was saying, all the survey like National Family Health Survey, district level health survey is done with the help of multi-stage sampling. And National Family Health Survey give us the data of immunization, breastfeeding, domestic violence, anemia, iodine deficiency. All data come from NFHS DLHS. So who give us immunization data? NFHS DLHS. Then both NFHS DLHS collect data from multi-stage sampling. As I said, NFHS and DLHS, they give us the data of immunization, breastfeeding, domestic violence, anemia, iodine deficiency. So they can ask, where are we getting the data of immunization? From NFHS, DLHS. Then census is also one more thing. It is never done by sampling. In census, we take data from everyone. And they are asking these days that census do not give us which data? Census do not give us death data. It never gives death data. It only talk about the sex ratio, socioeconomic status and caste data. And census is based on de jure or de facto method. So it is based on de jure method. What is de jure? De jure method means people are counted based on their origin. Suppose kya? I am from United State of Bihar and I am traveling in Goa. So if I am in Goa and you count me in Goa, that is known as de facto method because defectively you counted me in Goa. So de facto is not used in census. In census we use de jure. Even if you found me in Goa, you will count me in Bihar. How? When you will go to my family in Bihar, suppose my elder sister is there, suppose my elder sister still live in our home in Bihar, you will ask how many family members are there, and my sister will say one of my brother is in Goa, one is in Delhi, like that they will give the data and you will count me in Bihar. So if you are counting based on origin, this is de jure method, and in census we are using de jure method. But all the death data are never coming from census. Death data is collected by SRS, sample registration system. So they can ask which of the following is double data recording method. SRS is double data recording method, because in SRS first ASA or field worker connect the data, then a supervisor go again and collect data again after 6 months. So it is double data recording method, SRS. A very good interesting question came from here, that in a 1 lakh population, if the sex ratio is more than 1000, sex ratio is more than 1000, then which of the following is correct out of the 4? So I hope you all know the formula of sex ratio is female by male into 1000. And if the sex ratio has to be more than 1000, more than 1000 can only be there if female is more than male. Female more than male means female must be more than half population. If female is more than half population, then on multiplying with 1000, it will come more than 1000. And male must be less than half, because female is more than half. So male is less than half. Then sex ratio will be more than 1000. Currently, what is the last census report? Only census can tell sex ratio. Government of India wrongly said sex ratio has improved. You can never know it without counting all the people. You cannot come in Mumbai and say sex ratio is good in Mumbai, so it is good in all India. You have to count everyone. So without census, you can never tell sex ratio is good or not. The last census report say sex ratio is 937. 937 means, of course, it is less than 1000. And less than 1000 means who is more? Female is more or male is more? Less than 1000 means male more than half. So male is more than half and female is less than half population. Then the sex ratio is less than 1000. So this is the reality. But if you want sex ratio more than 1000, then female need to be more than half and male need to be less than half. Then to all this question, you will only focus on the population of 1 lakh. You will not divide 1000 into 2. You have to divide population into 2. So when I say more than half population, what is half of 50,000? Half of 1 lakh, 50,000. So female should be more than 50,000 or male should be less than 50,000. Only then sex ratio will be more than 1000. Because you can see it yourself. If the female suppose came 60,000, male came 40,000, then 60 by 40,000 will be 1.5 and 1.5 thousand will be 1500. So whenever female is more than half or male is less than half of the population, then sex ratio will be more than 1000. So in our question, let's do it. First of all, don't divide 1000 into 2. Now we have to divide population into 2. So A and B can never be correct. Option is female more than 50,000, which is not given, or male less than 50,000. So of course the correct answer is D, male less than 50,000. If sex ratio has to be more than 1000, for more than 1000, male need to be less than half, female need to be more than half, which we solved. I hope it is clear. If not clear, feel free and ask it in the chat box. We will discuss it. So this is multi-stage sampling. Now what is multi-phase sampling? There was a student, Krishna, who did this study in Russia. He took 12,000 Russian, not girl, but student, and asked them that, can you touch the base of your ring finger, small finger, with your thumb? If you touch it without gap, let me know. Of course, you can see there is a gap through which my pen can go. So out of 12,000, only 47 can touch it without the gap. He went, oh, can you touch it without gap? Let me know. So he asked all the 47 who can touch it to go through echocardiography, and 3 were found to have cardiac valve defect. So if you can touch it, it's not a very good news. What is happening here? This 47 people who can touch it, some of them might have Ehlers-Danlos syndrome, hypermobility of joint. due to which they are able to touch without gap. So if there is hypermobility of joint, there can be hypermobility of valve also, which can lead to regurgitation and abnormality of echocardiography. Okay, so this type of sampling is multi-phase. You take one large population and then small, you keep taking from it. This is multi-phase. Okay, so these are the 6 methods of random sampling. Let me revise. If I have to choose 10 out of 100 students and I use lottery method, it is simple random. If I divide into boy and girl and choose 5, stratified random. If I choose every 7th student, it is systematic random. If I choose the cluster of front bencher or back bencher, it's cluster random. And if I choose a big map and from map small, that's multi-stage. But if I choose a large population and keep decreasing it, it's multi-phase. So these are 6 simple random. Now in the non-random sampling, first is convenience sampling, and it's not written here, but I will discuss it. In the non-random sampling, first is convenience. Convenience का मतलब जैसे मेरी मर्जी वैसे करूंगा sampling, and this is the way you will do sampling in your clinical PG. You will sit in OPD. Suppose you are in surgery and you are doing this research on anal fistula, because nowadays in anal fistula, if you just put one char sutra, one Ayurvedic thread, it can heal without doing surgery. So you are doing this research and you said that first 100 patient with anal fistula will be taken in my char sutra study. So if you say first 100 patient with anal fistula taken in study, you are doing it based on your convenience, because you are sitting and just taking them. So it's convenience. But let's say you are fed up with watching only male bum. You want to have some female patient also in the study. So then in the convenience sampling, you can put some quota. Quota means I will choose 50 male and 50 female I will choose in the study. So 50 male and 50 female are pre-decided by you to be taken in a study. Pre-decided to be taken in a study. So you have put in a quota here. That means again you are doing convenience, but you are doing a stratified convenience. You are again sitting in OPD and based on your convenience you are choose. But this time first you divide into male and female, then you choose. So it's a stratified convenience. We call it quota. The third type of sampling is a snowball sampling. After failing in my PG exam, first I went to tribal area of Chhattisgarh to work. Then I came and again failed, and I worked with the Butterfly NGO, which work with street children. So one work which was given me there in the last time was to de-addict all the children, because you might have seen some children, they sniff from one cloth while picking some rags. So those children, what they are sniffing Sulochan, the glue which came to repair the puncture of the truck tire, and they call it solution, but it is actually Sulochan. So I got one guy, Akash, who wanted to quit it. He was from Chandni Chowk slum area, and I took him to Ghaziabad and I asked, tell me about your other friend who want to quit. So he gave me data of 3 more friends. Then next time we 6 people went together, 4 of these, one me, one driver, and all of us become good friends. It doesn't mean we all sniff together, but they were asking me to do it, but we did not. And then I asked from them, tell me about your other friend who want to quit. So they told me about more friends, and therefore my sample size kept on increasing till it went to 23 sample size. So what is happening here? Just like a drop of snow, when it falls from the top of the mountain, by the time it reaches the base, it becomes a big snowball. Similarly here, we start with one child, and by the time it rinds, we have 23 people in our study. So this is a snowball sampling, and 2 questions come from here. First question is, in which sampling we can add participant during the study? So only in snowball sampling, participant can be added while doing the study. Participant added between study, and a participant added between study, not just at the beginning, but also between study we can add. So here sample size keep on growing continuously. Second question they ask is, which of the following sampling is done for MSM patient, IDU means intravenous drug user patient, MSM patient. So all the disease which are hidden in society, these hidden diseases like HIV patient study, intravenous drug user patient study, inhalant intoxication study, which I just told about sniffing, or MSM study,
all are done by snowball sampling. MSM you know ना, आदमी हूं आदमी से प्यार करता हूं, बस यही गुनाह मैं बार बार करता हूं, आदमी हूं आदमी से प्यार करता हूं. MSM means male having sex with male, है ना. So you understand how this type of sampling is done. I will first find one male, then without falling in the trap I will ask about their lover, and then again without falling in the trap I will move to another sample and keep doing this study. So this type of thing is snowball sampling. Very difficult to do MSM study, but you understand all hidden disease can only be found by snowball sampling.